over two cause and right. So sebenzisani lo document ke ayike ilungisa le ekade maphaya ola ngaphambi lokuba siyamkela ngaphakathi kwethu idepartment endifuna baphakame sibabone bathe shayi lapha ya Department of Health Minister Umkhize sibashayile izandla siyabemukela. May I also recognize the Department Phondo of Health maybe khona ama officials at department masibabone bangaphi as a record ke ayinihleli kude kakhulu nayizolo ndithe ningahlali kude kafushane abantu bazothi mebefuna ukuthetha nani izinto babe la ibani la ifushane nginikhombe eduzane ufuna unganiboni uthi nina ningama officials department yakwa health ephondweni lethu iGauteng manginibone ke nihlale la fushane ne national department ndinibone ukuze mekukhona into ezidlumuziwe ze province banaza hleli kuphi na phakathi kwethu ke kunama councillor akhona kukhona iCouncillor emphiwe igama lalo izosamukela so sendimncedile nokho ukuthi azi ukuthi ngobani abanye azobamukela kunetafula kunamatafula akhona on the other side staff se Department of se Parliament ukuzothi izinto ongakazange uzithetha apha you then have to take those to the tables there on the table is on that side. Yes, that's our staff members from Cape Town also who are going to process request queries abazozizisa ngaleke kodwa ke besingacela bandla torho kube khona umfundisi ozokasivulele noma nje asibangasana namhlanje asasesinceda nje nange chorus so bese siziva sifisile lathi ecaweni nje mengasasikhulekele asiqalele ichorus noma ngubani ke nje ongasasiqalele siyovuya kakhulu. Ukhona oholwa inkosi ukuthi makasikhulekele makeze ke asikhulekele.
Dunyuga na lukololwa delugame lekho ukhululwa mdunyuka nalukhololwa delubambesa ngeongenana lekho yenoma kunzima noma kunzima noma wenyo kukhululwa ngeongenana lekho noma kunzima kunzima noma wenyo kaotukho ngeongenana lekho ezolweni ayo matata ayo matata ayo matata ayo mude ayo matata hoyo mototo hoyo matata hoyo mude molete
Kristo bawukunaphakade ekuseni nje bawukunaphakade mnini into zonke naba bantu bakho bathe vukule ndawo bakumenywa bawukunaphakade mnini into zonke idepartment Kristo bavumile basabela Kristo kokunaphakade sicela ke wena Nkosi Thixo isona amandla onke ungene nathi kule ndawo mnini into zonke sonanene siyazi Kristu Thixo kunaphakade ukhona ngendawo bangunaphakade umtyholi uSathane Kristu kunaphakade hlala ke ezincakameni zelimizi abantu bakho Nkosi Thixo xa beza kwethula Nkosi Thixo kunaphakade umsebenzi phambi kwabantu bakho Kristu kunaphakade siyakumema ke Nkosi Thixo kunaphakade zithi konke kuzawuthethwa Nkosi Thixo isona amandla onke ibe kuko kuzawusebenza bangunaphakade ezithi naba bantu Nkosi Thixo kunaphakade bathatha information bayigqithisele phambili ngenxa yakho Yesu Kristu Nkosi yethu kuze bengunaphakade amen bawethu asezulwini liphathe ngobungcwele igama lakho ubumkani bakho mabufike intando yakho mayenziwe emhlabeni njengoba isenziwa ezulwini siphe namhlanje isonka sethu semihla ngemihla sixolele izethu asibaxolela abasonayo ungasingenise ebuyendweni sindise enkohlakalweni njengoba umkane bobakho namandla ngawakho nobungcwatha bobakho kuze bengunaphakade amen
Siyabulela kakhulu ke tata wasifaka nani ke ecaweni hayi uThixo uyosivela sifikile ecaweni apha eDlamini Multipurpose Center ya make si phe lamalunga ekomiti endihamba nawo azethule ke emva koko sobe sesicela ke ukhansela uSibanyoni othunywe ukuthi makasamkele ke kule nginginya after the introductions of ourselves as members of parliament we'll request Councillor Sibanyoni to then welcome us officially.
Sanbonani, goeiemorgen, good morning. My name is Philip van Staden. I'm a member of parliament and a member of this committee, and I'm also a resident of Gauteng. And thank you for having us here today. Thank you.
Molweni bahlali. Igama lami ndingumxolisi, isurname nguSotsha. Ndililungu lale komiti, kwiphondo loluni Cape. Inkosi.
Good morning. My name is Kenneth Jacobs. I am from the Western Cape. I'm a member of this portfolio committee. Thank you.
Sanbonan, igama lami uChididzi Mnyai. Ngibuya la Gauteng ngiyilunga le committee yezempilo and ngimember ye National Assembly.
Sanibonani. Igama lami nginguMagdalena Duduzile Hlengwa. Ngiqhamuka AZN Londi. Ngililunga lale committee. Ngiyabonga.
Molweni, igama lami ndinguPhumza Dyantyisi uMamXesile. Ndisuke Eastern Cape. Ndililungu lale committee yezempilo. Jovicho. Hola bangane hola. Hola mdeni hola. Hola Diepkloof hola. Hola Soweto hola. Sanibonani. Dumelang. Libitso la ka ke Anakela. Leloko la committee ya tsa maphelo. Ke yo mongwe ya tswang yona province ena ya Gauteng. Abaninzi niyandazi mosandithi bangani. Jovicho.
Dumelang, ligae. Igama lami ndinguSiviwe Gwagube, ndililungu leParlamente yase Western Cape, ndililo nelungu lale committee yakwa health.
Sanibonani. Ninjani. Igama lami uNaledi Chirwa ke tswa Mamelodi ko Pretoria, also from Gauteng, and I'm a member of the committee on health. Thank you so much for coming. You could have been anywhere else, but you're here with us today, so thank you.
Dumelang. Kunjani. Ora. And a very good morning to each and every one of you here today. It's so good to see so many of you coming out here today for this public meeting. My name is Ismail. I come from the Gauteng province, and I serve as a member of parliament on the head.
Thank you very much. I'll wait for Councillor Sibanyoni to come here to welcome us. Meanwhile, let me recognize the arrival of MEC Bandile, Dr. Bandile Masuku, the MEC of Health in Gauteng. Thank you very much for coming in. We will hope that will also assist us in listening to some of the challenges that people might raise and their happiness by being here.
Sanibonani Mphatho, Program Director, thank you very much for the opportunity. Let me acknowledge our Minister of Health, Dr. Zweli Mkhize in absentia, and his office. Let me also acknowledge our MEC, Dr. Bandile Masuku, and his office and officials, the Polio Committee of Health, and all the officials of health. Thank you very much for being here with us today. Ngiyacabanga ukuthi sizo understand ukuthi services, equal services to all sikhuluma ngani namhlanje. Sizoyiqonda singabahlali basoSoweto ukuthi masifuna le NHI sikhuluma ngani. Siyabonga kakhulu ukuthi nibe nathi la namhlanje. Siyabonga mphakathi waseSoweto.
Recognize legislature in Gauteng legislation. Are there any that are here? Okay. MPs. Any of our colleagues from Cape Town who are here, MPs? Oh, Molo. Molweni ke. Very much, yeah. See. Okay, two of our MPs, our colleagues. So I will have to just take a register soon as to, by the way, which portfolio committees do they sit in, so that here we deal with health. If there are issues about roads and cattle crawls, there are two colleagues who will also assist us with that regard. For the benefit of us going forward, I will need here and there a translator to do the Zulu part. I'll be doing Zulu and English interchangeably, but then we'll need to just make sure some of our South Africans who would have wanted to be covered in other language will then probably benefit from that combination. We are here as members of Parliament sent by the Speaker of the National Assembly, Mayor Thandi Modise, on a program that was received in Cape Town from the Department of Health nationally. There is a document that was brought in there, coming in from the department, having been supported by the cabinet, and then it landed in Cape Town. When it landed in Cape Town, the Speaker decided it must come to us as a committee responsible for that program that was coming through.
Silapha singamalungu eParlamente sithunyelwe ke ngusomlomo weParlamente emveni koba ethe wafumana ixwebhu elivela kwiCabinet. iCabinet leyo yayifumeneke kwisebe lezempilo, ngoku ke yanikezelwa kule committee ukuba mayize nalo ke kubahlali.
That document is called NHI Bill.
Elixwebhu ke libizwa ngoba ke NHI Bill.
Into le esike yathethwa kule lizwe lakithi kusukela ngabo 2011 yayise green paper yahamba ngo 2014 yaba white paper, indlela yayimthetho ehamba ngalo leyo imithetho sivivinyo. Kuthe ngonyaka ophelileyo umnyango wezempilo wayimuva from being a draft bill into becoming a final bill ke abasebeyiletha ke ukuthi ke makebe manje ke ihamba ke umgama wayo eParlamente izoba iza nasebantwini nizophefumula ngayo.
It's a program which was started by the department as a green paper, and then we passed that stage to a white paper, and then we passed that stage as well and became a draft bill and brought to Parliament. That is the program, the bill that we are bringing to you, that we have to discuss with you.
For us is to listen to South Africans, as we have listened to, can the process of distribution of material be limited to no noise or be done at the entrance there, please? This program was then brought to us, and we are here to listen to yourselves, to get your views and your comments on the understanding that the custodian of this document, which is the Department of Health, have done their work in the society to make South Africans understand what is this document, what is it all about, and we are here to get to listen to your comments on that bill.
Size apha ke ngelo phepha ngalo nkqubo yalo mthetho uyilwayo oyibill uba ke sizomamela nina emveni ba ke nithe nafumana isishwankathelo soba ke lo mthetho uyilwayo kanye le bill ithini na. Kuzofuneka sive izimvo zenu uba nicebisa nithini na ngawo. Sinethemba loba ke abaqulunqi kanye abayili balo mthetho uyilwayo isebe lezempilo, Department of Health, lizile kwabanye benu labarhabulisa ukuba el phepha lithetha ngantoni na okanye le bill ngantoni na.
There is a global trend championed by the World Health Organization, which is a concept of universal health coverage, where the WHO is saying all countries should go a route of making sure that their citizens are cared for, looked after health-wise through a program of universal health coverage.
Elena ke into eshunyayelwa ke ngumbutho wezempilo wehlabathi ekuthiwa yi-World Health Organization yokuba ke ilizwe nelizwe malibe nenkqubo yalo yokuqinisekisa ukuthi abemi balo bafumana inkathalelo yezempilo elinganayo bantu bonke ngokulinganayo.
This universal health coverage in the world has been given a name in our country of national health insurance, as it has been given another name in UK of NHS, National Health Service. All of it, the seed or the root being universal health coverage, just different ways of doing it in different countries.
Le nkqubo ke yokunikezela impilo yezempilo elinganayo kumntu wonke apha ke kwilizwe lethu ithiywe igama lokuba yi-NHI National Health Insurance, kanti ke kumazwe angaphesheya afana neBritane bibiza i-NHS National Health Services.
This bill looks into all South Africans,
Omhlophe, omncinci, nomdala, osemaphandleni nosezidolophini bonke banikezelwe inkathelo yezempilo efanayo nelinganayo nokuba bemi njani na ngokwesimo sezezimali.
The bill is provoked by the situation in the country, which is an anomaly, that if all of us were to have flu, we will get some help wherever we go. Sometimes it may take longer because the clinic around where I stay is overcrowded and there are long queues. But if the illness becomes very complicated, it demands more sophisticated treatment. Protection is embedded on this bill the way it is structured.
Lo mthetho ilwayo ke uthi abantu belizwe mabakhuselwe ezipukuthweni ngohlobo loba umuntu angathi xa egula angakwazi ukusukuma ayo koogqirha ayofumana unyango lwezempilo ngenxa into yoba ke engenamali epokothweni. Lo mthetho ilwayo ke uthi mawukhuseleke ipokotho yakho ungadingi uba mawuqongqothe imali yakho yokugqibela uyofumana unyango mawulufumane noba unayo imali.
The bill is leaning very closely to the human rights program that says a right to life, a right to health is a fundamental, is a right that supersedes all other rights you can ever think of. Because a right to complain, you can only complain if you are still alive and well. Once you're dead, there's no complaint of a dead body. So this is the only last right you can hold on to make meaning and to allow you to even still fight for any other rights you could ever wish to have.
Lo mthetho kuyilwayo usekelezelwe phezu komqulu wamalungelo oluntu uthi ilungelo lokuphila lengaphezu kwalo naliphina elinye ilungelo umuntu anoba nalo ehlabathini, ilungelo lezempilo okanye lenkathelo yezempilo lelinye lamalungelo aphezulu ngawo nawuphina amanye amalungelo. Kuba ukuze ukwazi ukhalazela elinye ilungelo lakho okanye ulibange kufuneke uphilile kuqala. Kongoko kusithiwa ke ilungelo lokuphila lelona libaluleke ngawo ngaphezu kwawo onke amanye amalungelo.
The bill proposes that there should be a single purchaser of services and a single payer ngendlela ezoshayeka ngayo yokuthi hayi noma ngabe ke la mayeza la lemshini ithengwa eLimpopo noma eCofimvaba noma eMzimkhulu kube khona indlela ehlelekileyo yokuthi kube khona indlela yokuba kube single purchaser of those resources as much as a single payer yalawo of those resources.
Lo mthetho ilwayo kithi kufanele kube abemnye umuntu othenga amayeza okanye izixhobo okanye imithombo yezempilo kunye neenkonzo zazo azithenge kwindawo enye ibe nguye ohlawulayo, kubekho indlela ekulungiswa ngayo okanye ukuhlelwa ngayo boniswana ngayo kuba ke inkonzo okanye izixhobo zezempilo sawuzifumana ngolhlobo nolhlobo kule ndawo inye zihlawulelwe ke yilo ngxowa inye.
Obani ke abazothi bahlomule kule program? Hayi nikeza le ndoda. Obani ke abazohlomula kule program? One, ababonke abantu baseNingizimu Afrika abane-IDs. Mongakayifumani i-ID hambe uyifuna ngoba kuzoba nzima ukuthi ubhalise singakwazi noma wala. Number two, bonke abantu baseNingizimu Afrika abathe baba zi-permanent residents of the country after sebe applyile bafumana ama-documents ba basuka amanye amazwe sebeyamukelekile apha ezweni lase-South Africa. Number three, abantu baseNingizimu Afrika abazi abantwana bethu abafowethu omama bethu otata bethu abasematrongweni. Number four, abantu abala eNingizimu Afrika abaphuma kwamanye amazwe ingcukaca zabo ezingakabi kahle hle ukuba ngaba ama-permanent resident babizwa ngokuthi bazimbacu abasathenje ukufika abakhosela ke nabo abantu ke ababhekeke ukuhlomula kulolu hlelo ke ningandiva kakubi ukuthi ke awuzohlomula mongenayo i-ID kakade phela kufanele ubhalise kodwa nale bill isondele ekutheni bantu mabakhawulezise babe ne-IDs. ID nje is a book of life hlala ikunceda ukuthi u-access zonke izinto ozidingayo ezweni.
Who are to benefit under this fund or under this bill? The people who are to benefit, firstly, are the South African citizen, those of us who have South African IDs. We are not saying you are compelled to have an ID to get healthcare services, but this bill will expect every one of us to be registered on a certain center with their details and with their IDs. So if you don't have an ID, you need to have an ID because you'll have to register to benefit from this fund. That's point number one. Secondly, the second group that is to benefit under this fund are the permanent residents, those people who are coming from other countries who received permanent resident status in South Africa. Thirdly, the other group that is to benefit the asylum seekers, those who came here through political wars and so forth from their countries who fled to South Africa, but there's not yet received the status of being permanent residents. Even them, they are supposed to be assisted under this fund. Fourthly, the fourth group that has to benefit the sons and daughters, the fathers and mothers of us who are in correctional centers, that is those who are in prison. They also are supposed to benefit under this fund.
Yes, it is true, you need to be registered. Among the reasons the bill gives for registration is that they will need to know here in Soweto, how many people do we have? And maybe are the facilities that we have here adequate enough for them? Probably how many other general practitioners can we rope in to support this program? Can we say we are happy with the hospitals and all that we have? So registration is but like part of compiling a data for the country and know which population is where going forward.
Ewe kufuneke umuntu abenayo incwadi yesazisi ukuze abhalise kuba ke phansi kwalo mthetho uyelwayo le bill kuzofuneka abantu bebhalisile ukwenzela sazi ukuthi kule ward okanye kule ngingqi abantu baxhomekeke kwiclinic okanye kwiziko lezempilo okanye isibhedlele esikhoyo bangaphi na ingaba inani laba bantu lilungele le clinic okanye kufuneke zongeziwe na okanye ingaba ogqirha abakhoyo kuloo ndawo okanye kuloo ward babanele na inani labantu abakhoyo asebebhalisiwe kule ndawo ukwenzela uba kufuneke kongeziwe kukwazi ukongezwa kungoko ke kubalulekile kakhulu ukuthi abantu babhalise ukuze siyazi ukuthi kwindawo ethile abantu abakhoyo banga iklinikhi ephaya iyakwazi ubanceda okanye baninzi for la clinic njalo njalo.
Le bill ke iyasinyanzela ukuthi noma iyasicela ukuthi masibhalise mawugula uqale endaweni yangakini eklinikhi yangakini uthole ukusizwa khona nanoma ningabahlali baseSoweto ungathi nje mawukhwehlele kanye bese uvuka uye eChris Hani Baragwanath Hospital ngoba leso sibhedlela akusona nje esabahlali baseSoweto kuphela. Leso sibhedlela kufuna sisilekelele noma kusuka abantu bethu abagula kakhulu base Northwest nabasuka eLimpopo ngokubhekekela ukuthi bagula ngalento engasakwazi ukulapheka eklinikhi yangakubo kodwa sidinga isibhedlela esingaphezulu ngoba lawo maphondo awakabi nazo isibhedlela ezilelo zinga okwamanje.
This bill is encouraging us that if we need medical care, we should start by using the primary health care centers. We cannot just, after one cough, jump and run to Baragwanath Hospital because that Baragwanath hospitals or the hospitals in that status are not only meant for the people who are from Soweto or in the area around them. Those hospitals are intended to assist people from other provinces as well that do not have hospitals of that status.
Hence, there is a proposal in the bill that these hospitals like Chris Baragwanath Hospital, Steve Biko, be monitored or be governed at the level of the minister so that it can open up, they are called central hospitals, so that it can open up space for other citizens outside the area where that hospital is physically located. That is the thinking by suggesting that it be moved out of the hands of the provincial government, but it be at the jurisdiction of the national minister.
Izibhedlele ke ezifana ke kunye neBaragwanath nezikumgangatho wazo kuthiwa ke mazonathelwa njenge-central hospitals eziphansi komphathiswa wesizwe azizuba phantsi kwelawulo lophando kuba kaloku zifuneke zincede nabantu abasuka kwamanye amaphondo abangenazo izibhedlele ezikwela zinga ngokwezixhobo neenkonzo ezifumaneka khona. Kungoko ke ezaa zibhedlele funeke zingagcwaliswanga ngabantu abalapha kweli phondo okanye abalapha eSoweto ngenxa yokuba isibhedlele sikufutshane kubo ibathathu basesabo. Ezaa zibhedlele funeka sivuleleke kubo bonke abantu boMzantsi Afrika abakwamanye amaphondo abadinga iinkonzo ezikwisibhedlele esikwela zinga.
Le bill ke ithi makube khona iboard ezogada wonke lo mcimbi yabantu abayishumi abazoqokwa nguminister bona ke bese bephinde beqoke uCEO esikhuleka khona futhi sithembe ukuthi kobe kuqokwa abantu abathembekile abangezokweba abazongoba amasela bebimali kaHulumeni yokusiza abantu kulomcimbi omuhle kangaka.
This bill also indicates that there should be a board established to safeguard the funds or the operation under this bill, and those board members have to be appointed by the minister. There should be a board members of 11, and then themselves they should appoint a CEO among themselves. And we hope that those people who will be elected in that board are people who have got integrity, who are ethical, who are honest, people who would not see the chance of abusing or embezzling the funds which are meant for this bill or to assist the people under this bill.
The bill proposes various committees to be established in it. I'll just mention three. One of the committees that the bill is proposing must be is a committee called a pricing committee, because it is unheard of that in one country you can have a price of a cesarean section in Chris Baragwanath Hospital different than across the road in another hospital because it happens to be private. So we are saying the pricing committee, among other things, will standardize prices of those items or commodities that South Africans must access. People must not wake up and decide what price this thing must cost, and therefore whoever comes in there pays. So that is one of the reasons for this bill proposing a pricing committee.
Kwakhona ke le bill ithi kufanele kubekho ikomiti ezisekwayo phansi kwayo, phakathi kwazo singabalula ikomiti ezoba yiyo elawula amaxabiso enkonzo zezonyango. Umzekelo ukuba ngaba mhlawumbe umuntu uya eChris Baragwanath Hospital uyofumana umntwana ngenkqubo ekuthiwa i-cesarean section ngamanye amazwi ngotyando abizwe imali ethile, kodwa ufumanisa ukuthi kwesinye isibhedlele esingaphesheya nje kwendlela kuba sona kuthiwa si-private ufuke ixabiso lilukhulu kakhulu luhlukile kweli leseBaragwanath. Le pricing committee izoba yiyo ke emisela amaxabiso alinganayo kwizibhedlele noba sesakarhulumente noba sesabucala amaxabiso kufuneke ilingene enkonzo zezempilo.
This point, South Africans, is very important to notice because it also protects even those who've got medical aids, because a lot of people with medical aids think they have got a heaven, but by June, July, their medical aids are exhausted because they've been charged exorbitantly wherever they are. And come August and September, they then come and line up in the government hospitals because they've been told where they are, you are still sick, but we cannot look after you if you don't have money. Get money out of your pocket if you still want to be assisted.
Elinqaku libaluleke kakhulu nakwabo bane-medical aid. Kuba mhlawumbi umuntu ene-medical aid acinge yena ulibambe ngesandla izulu. Akunjalongo ke kuba ke lo mthetho ilayo uyabakhusela nabo bantu. Kuba umzekelo kungamandi ngoku uJune engekabethi une-medical aid yakho uyanaphina kwesiphina isibhedlele ufumane naliphina unyango. Kodwa emveni kaJune, July kuthiwe ziphelile funds. Kodwa ube usatsalelwa yona imali ye-medical aid. kunyanzeleke ngoku uhambe uyofola kwisibhedlele sikarhulumente kodwa ke ube ungekanyangeki kodwa ke ngokuziko onyangwa kulo lona lithi asikwazi ngokukunceda kuba i-medical aid yakho iphelelwe imali elinqaku ke le committee ke ye-pricing iyabanceda ke nabo bantu ba amaxabiso ekutshajwa wona mawalingane kuzo zonke izibhedlele noba zezikarhulumente noba zezabucala.
There's another committee suggested by the bill, stakeholders committee, and that will actually make the beneficiaries to have a word or to make inputs with regards to how they are being looked after with the fund that is going to be there.
Kuphinde kube khona enye committee ekuthiwa i-stakeholders committee yona ke yenzelwe ukuba abantu abafumana inkonzo phansi ke kwale NHI Bill bakwazi nabo ukuba neengcebiso nezikhalazo abazibhekisayo kuba bantu bazobe befumana kubo inkonzo ukuze ingcebiso zabo zikwazi uvakala bakwazi uba nelizwi nabo ukutsho ukuthi ke sinqwenela ukuthi nalena into ihoywe phansi kwale bill.
There are various other committees, but the last one I just want to touch on is a package of service committee, a committee that's going to decide what exactly are the services that we should receive as South Africans. And they will probably package a lot of services that we need. There may be few services that are out of that package. To give an example, if you think you need to be supported because you are twice my size and you need to be assisted to kusho amafuta apha kuwe by a method called liposuction, we might think it's better and cheaper to buy you a pair of shoes at 1,000 rand than to take you to theater and do liposuction with all the risks that are there and use so much money. So, but if you think that you deserve to have a liposuction, the bill allows you to write to the minister. Say, Minister, I was denied liposuction. I here apply and I hear you, I ask you to grant me, then the minister will decide yes or no. So there's that space of allowing you if the MEC, but I think the MEC will buy you techies because I see him is on the road most of the time. So he will just be joining him because and be like him in his size.
Enye ke ikomiti ebalulekile kakhulu apho kuthiwa yi-package of service committee, ikomiti yona eyiyo ethatha isigqibo zoba zeziphina inkonzo ezimele ukuthi ziyahlawulelwa phansi kwale komiti kwiinkonzo zezonyango. Siyathemba ukuthi uzoba lude uluhlu lwenkonzo umuntu amele uncedwa ngazo okanye le ngxowa-mali emele uyakuhlawulela ngazo. Phakathi kwezo sicinga ukuthi azimelanga uhlawulelwa mhlambi kunothiwa mhlambi azi le ngxowa-mali ayinozihlawulela into efana noba mhlambi xa uzibona ukuthi wena umkhulu ngomzimba wade walingana nam kabini mhlambi ubona ukuthi ufuna ke ngoku ukuba mawufumane unyango oluthile uqhaqho oluthile lokuzama ukuphungula amafutha ukuze uzibone usislender nawe mhlawumbi ke omnye angabona ukuthi ngcono kunoba mandifune uyokwenza le operation ngcono ndizithengele iiteki zam ndivuke kusasa nasemva kwemini ndiyogijima ukuthoba ubunzima bam. Ukubaba mhlawumbi wena uyabona ukuthi nene wena unyanzelekile ukuthi funeke uyile kule nkqubo yoba mawuyoqhaqwa kuphungulwa amafutha kuwe unako ke ukubhalela umphathiswa wesizwe uchaza ukuthi mna ukuze ndibe nokuthoba ubunzima bam ndibe sisilenda ndicela undivumele mphathiswa ukuba ke ndiyokwenza oluhlinzo kuzophungulwa umhlehle okanye amafutha kum.
Okay, phansi nomhlwehlwe phansi. Ithi ke le bill ayizovala ukusebenza kwama-medical aid kodwa ithi kuzoba khona a complementary izosebenzisana nawo ama-medical aid ayizowavala ama-medical aid kube khona uhlelo lokuthi ke kuqaliswe lapho mekukhona mhlambe izinto ezithi zibe izigulo ezinkulu usenayo i-medical aid bisike encourage yosebenza lapho kodwa igama abalisebenzisa kakhulu abathi a complementary role that will be played by i-medical aid.
And the bill is saying the role of medical aids is not going to be stopped. Instead, the medical aids are going to play a complementary role in terms of the kind of services of illnesses that somebody is falling on or needs to assisted in, where the medical aid can also play a part to cover for the costs to complement whatever the fund will be paying for the service that one would be getting.
In the previous State of the Nation address, not the one that we've just had last week, even though that one, the President also spoke at length about the NHI, the starting point was when he said, NHI shall be implemented in an incremental manner, in a staggered approach, meaning that you will not wake up in first day, first month, first year, and see NHI all over, but we will be in a staggered and an incremental manner so that by 2026, in the whole country, you are able to see signs of NHI, most of the areas by 2026.
Kwintetho kamongameli uba siyakhumbula ingeyiyo le yangoku le yalo nyaka upheleyo nangona ke kunakulo nyaka beke wathetha kakhulu ngalo mthetho uyilwayo okanye ngale bill. Umongameli watsho ke kwintetho yakhe ubume besizwe kulo nyaka upheleyo uba ke lo mthetho uyilwayo we-NHI okanye le bill ye-NHI xa iqalisa usetyenziswa ayizuvele isetyenziswe kwilizwe lonke ngexeshanye, izawusetyenziswa kancinci izawusetyenziswa ngokukhethakeleyo, iinkonzo zayo zawuye zisandiswa kwiindawo ezigqagqeneyo ezahlukahlukeneyo. Kuzokwala ngonyaka ka-2026 kulapho ke ngoku sizawulindela ukuthi kulo lonke ilizwe jikelele sibe siyazibona zonke iinkonzo zika-NHI.
There is an independent governance structure in the country called Office of the Health Standard Compliance. That independent structure is going province by province, clinic by clinic, to go both private and public, to look into certain things that must be fulfilled by that health facility for it to be worthy of being a site to be accredited by the NHI fund to do NHI work.
Kukhona ke ikomiti ezimeleyo ebizwa ngoba yi-Health Standard Compliance eyiyo ke ejongene nomsebenzi wokuba izibhedlele neekliniki zikuwona umgangatho wokuba zibe zibizwa uba zingamaziko onikezela inkathalelo yezempilo. Ela ofisi ke ye-Health Standard Compliance inoluhlu lemiqathango nemigaqo ekufuneke iziko lezempilo libe lithobela ngeziko elinikezela inkathalelo yezempilo. Elo ziko ke le-Health Standard Compliance lihamba lityelela ikliniki neekliniki ekarhulumente neprivate, isibhedlele nesibhedlele esikarhulumente nesiprivate, ukukhangela ukuba ziyawuthobela na umgaqo okanye ziyawufezekisa na imigaqo kumele uba ziyawafezekisa ukuze sibe kumgangatho wokuba zithathwe njengezibhedlele ezinovunywa zisetyenziswe phantsi kwenkqubo ye-NHI.
Uxanduva lakhe kurhulumente ukuthi makalungise iinkonzo zalawo makliniki nezibhedlela ezingekho emgangathweni, so that by the time kufika le process ye-NHI fund yokuba accredita ibafike nokho besemgangathweni ukuthi bamkeleke ukuthi mabalethe iinkonzo zezempilo ebantwini.
It is therefore the duty of the state to make sure that they rectify whatever mistakes or faults or shortfall that are there in the present healthcare centers that we have, so that when the time NHI comes, those backlog or services which are lacking should have been fulfilled and updated.
And in 1994, when President Nelson Mandela became the president, which we are grateful, we are celebrating 30 years of his release from Robben Island this year, he, without probably advised, without knowing whether there's money or no money in the country, made a fundamental shift policy which was implemented that said all pregnant women must access clinics, even if they don't have money in their pockets or in their homes. All children under 5 years of age, if they are sick, must be seen in our facilities, even if there's no money in their families or in their pockets.
Umongameli uMandela ngo-1994 ebesibhiyozela ke bayigqibe iminyaka engamashumi-3 wakhululwa elivalelweni kulo nyaka, wathi ke ekungeneni kwakhe elulawulweni engakayazi noyazi uba ikhona na imali kweli lizwe okanye ayikho, kodwa wathatha isigqibo soba waphumeza ipolisi ethi bonke abantu abangomama abakhulelweyo benemali bengenamali mabaye kumaziko ezempilo bafumane inkathalelo okanye uncedo lwezempilo balidingayo olumahala olungahlawulelwanga. Waphinda wathi nabantwana umntana oneminyaka emihlanu nangaphansi makanikwe inkathalelo yezempilo ayidingayo, noba abazali bakhe banayo imali okanye bengenayo makalifumane lo mntwana unyango lwamahala kuba eneminyaka emihlanu nangaphansi.
So this bill is extending that service to every young and every old, to the rural and urban, to the employed and unemployed, to the rich and poor. It extends it beyond just the pregnant women and the under 5 children.
Lo mthetho kuyelayo uyayandisa ke uyayivula iringi yayivulwe nguMandela yabantu abakhulelweyo nabantwana abaneminyaka emihlanu ngaphansi. Ngoku ithi ke le bill makuncede omncinci nomdala osisityebi nolihlwempu oezilalini okanye elapha ezidolophini wonke umuntu makafumane inkathalelo yezempilo elinganayo nefanayo ayifumane mahala.
So that is, I cannot do all 11 chapters of this document word for word. I might have missed some of the other things, but fundamentally that is what the bill seeks to address. And we are here just summarizing with the understanding that the Department of Health, who is the custodian of this document, have done their own work amongst our citizens, and therefore we are here to listen to your comments, take your views, and connect them with other views we have heard in other parts of the country as we go to Cape Town to consolidate them. So this is now going to be a space open for you to guide and comment and give your views.
Esike sishwangathelo ke sale mthetho ilwayo uzahluko zili11 zi11. Ewe mhlambi zikhona indawo esingazinyathelanga kuba besisenza isishwangathelo ngoku. Kodwa ke bukhulu becala lo mthetho ilwayo ke uhamba ngolo hlobo sinethemba loba ke isebe lezempilo nelingumnikazi wale bill lizile ke kwabanye benu mhlambi kwikona ngekona labarhabulisa ke ngalomthetho ilwayo. Ngoku okwethu kuba masize kuni sive izimvo zenu banina nithini nangalomthetho wezempilo ukuze ezo zimvo zenu zidityaniswe nezinye esezikhona apha ke kule komiti ukuze xa kugqityezelwa kuqukunjelwa lo mthetho ilwayo nezenu izimvo ziqukunjelwe sivulela ke ngoku elothuba loba ke umuntu nomuntu enze igalelo lakhe acinga ukuthi unolenza ngokucebisa nokuxhobisa le komiti ke kule bill.
Then before we start, let me just, I've recognized another leader. This MEC is very lucky that he's going to be here. Not only, he's not going to work too hard because he's accompanied by the HOD, Professor Lukele. I would want you to stand up, Professor, so that people can see you, so that they know where to take their problems to. This is Professor Lukele, the head of Department of Gauteng, Department of Health in this province. Thank you very much. In the other part of his life, he's a colonel in the army, colonel in the South African Military Health Services. So some of us salute him because of his rank. Ke kulomcimbi ay abantu abangathi ndizothetha ngebhokwe ihagu amagusha and the roads. Okay, we know there are challenges, road problems, water problems. If there is such a desire to talk about roads and problems of there, please write that down and leave it in the table there. We'll take it to Cape Town, to other colleagues of ours who are responsible for those other issues that are worrying our South Africans. For now, it's about NHI Bill, and we may not be able to close a space for other health-related matters that we'd like to raise. But for now, if we limit to that part, and each speaker is limited to 2.5 minutes, we will time you, and we request that sibambe ngalo mcimbi.
Apha ke ukuba ngaba kukho umuntu umhlambi onengxaki ezezinye acinga ukuthi ufuna uzibhekisa mhlamba afuna zibheke eParliament noba zezendlela okanye zezantoni amanzi njalo njalo sicela ingxaki ezinjengezo zibhalwe phansi sisiwe kumagosa aseParliament nanga itafule zabo zihlenga semadongeni ingxaki ezezinye ziye phaya apha sidinga abantu abazowuthetha bahlomle ngeNHI Bill kodwa ke singatsho ukuthi ezinye izingxaki eninazo zezempilo aninozibhekisa nazo. Ingxaki ezinokwenza nezempilo ninako ukuzibhekisa nazo namhlanje. Umuntu ozothetha sifuna sithethe nje malunga nento enokwenza nezempilo ne-NHI Bill. Enye ingxaki engenanto okwenza nezempilo uyibhale phansi uyinikezele phaya etafuleni ukwenzela uyonikezelwa ke kumasebe asebenza ngayo.
Khona ke sivumelwano sengisenze nenye imember engayivala ukuthi ikhulume esoshanguve asithi soulungisa umcimbi wayo sizomupha an extra half a minute so akazodlula naye ku3 minutes ngoba kusuke all the way from soshanguve esikhe. Okay, let me treat this block and this block as one block. May I request South Africans who would like to speak in these two blocks to raise their hands.
Abantu abafuna uthetha abalapha kwelicala baphakamise izandla zabo.
Okay. All those whose hands are up, move to the center. There's a gentleman there whose club lost very badly yesterday. Who's on Kaida where to sit.
Ndicela ke bonke ke abafuna uthetha baza kwezi zitulo zilapha ke kwi-center. Na uncedwa ke ngilamhlekazi uneqela liye labethwa izolo.
Shembandla. Inxeba lendoda lihlekwa njalo. Ngoba ngela kusasa kobe sekuwena. Yeah, I would like to have one straight line there. We must add more chairs if you can, but it will be one line going to the end. I take it that there are no South Africans who are seated here who have a desire to speak to the committee and have not moved to the center.
Siyacinga ukuthi ke kwabantu bahleli apha akakho omnye umuntu ofuna uthetha ongakange abe uzojona lo mgca ulapha phakathi.
Right. Right. While that process is being finalized, may I then request ngicele bonke ke abafuna ukuthetha necommittee abahleli kule ndawo baphamise izandla zabo.
All those who want to make their input from this block can raise their hands.
Can all those whose hands are up here come to these chairs on the center and start filling them?
Sonke ke thina abaphakamise izandla masize ke kwezi zitulo zikweli cala.
Yanzima kangale into ukuthola izitulo zokuhlalisa abantu. Nazi izitulo phaya emva kungabi nzima ukuthatha isitulo okuhlalwe phansi. Staff members eParliament nazi izitulo phaya. Kwanzima nje lo line usuze kwahlala lo waphela awupheli lo line. Okay, I take it that there is no South African who wants to engage with the committee, who is still seated in the chair he or she was seated on when he came to this meeting. Akho umuntu osahleli lesitulo ahleli kuso angene wahlala kuso efika ofuna ukuthetha necommittee ongakamove ukuza apha ngoba ke that process now of getting South Africans to speak is closed. We take those who have indicated and are sitting on the chairs. So your time is 2.5 minutes. All South Africans who want to speak are sitting in the passage now. Evaluate your process. Right. Okay, ama interpreters will allow. To our interpreters, if the people contribute in English, because all members can understand English is fine. If they speak Tsivenda, Tswana, Zulu, you'll have to assist by interpreting or summarizing, not word for word, summarize what has been said there. Moqeda, you move the people and then then ubaba mesukuma lesasitula kusesone sakhe uza phambili aze ngaphambili olandela ni manage kanjalo iprocess ke niyayazi le.
My name is Lazarus. I'm sure the lady who was just writing here got my name and my contact numbers. I can see here National Health Insurance Bill, but what is the NHI? This, it needs us as we are people concerned with health. Me, I'm a health member year committee. And there are a lot of things that this parliament needs to answer, but I don't know where to start. But I've got points that I want this committee to know about. Right. Can I fire up?
Uthe uyilunga le committee le clinic ethile.
Yes, a Rex.
Yeah.
A road report.
Nakhona mhlawumbe uzosho amabili ngoba amanye siyafuna ukwamkela eGeorge kwangena amalunga angu-15 ayo chairperson bama committee ngababeka one side ngathi mababhale zonke izinto ngizifumene zonke ngoba we may not be able to give justice to one clinic and all the issues. Mesibhalekile phansi well and good. Beka ezimbili ezintathu usiphi document yaleyo clinic bese sihamba naso eKapa.
Mr. Dhlomo, my reason is one. I'm here, I've been invited to be here. But let me say, I'm happy if the committee is here. I want us to know, as the committee, because people come, babizama meeting, bakchele guti, there's no stipend. I think you people has to invite us to meetings like this. Because now, Aero report, we talk about clinics, committees, they say there's no stipend. And people are working hard. And let me say, Mina, as a clinic committee, I call meetings, but I give people points, but they don't attend them. That's why I'm happy, Mr. Dhlomo, because I see you've got a committee here. Please address stipend, people are working. Can I give someone a chance? Oh, okay.
Good morning, members of parliament and everyone. My name is Anele Yawa. I am the General Secretary of Treatment Action Campaign. As I'm standing here, I believe that I represent more than 7.7 million people who are living with HIV and AIDS in South Africa. Before I can make some inputs on the NHI Bill, and with your permission, Chairperson, I've got two questions. The first question that I have before I make the inputs, since as the public we were told that the closing date for the submissions is the 29th of November, I want to know whether this means that the process has been reopened again, or what does it mean? Two, Dr. Dhlomo, as the chairperson of the Health Portfolio Committee, I would like to know from you and members of the Health Portfolio Committee, including the officials, how many of you who are using our public healthcare system or our clinics out of you there? I don't know whether must I proceed or you're gonna answer, or must I proceed, you're gonna answer at the end. But it is my interest and the interest of the public to know how many of you as members of parliament and officials who are frequently using our clinics. On behalf of TAC, we welcome the NHI with the hope that the NHI is going to come with health reforms and also address the principles on the universal health coverage. However, we've got some demands that we want to make. The first demand, if you look at the NHI Bill, it gives a lot of powers to one man, and that man is the Minister of Health. The NHI gives the minister powers to appoint the NHI board. It gives the minister powers to appoint the NHI CEO. It also gives the minister the powers to appoint NHI committees. You must ask ourselves, what will happen one day if the minister wakes up and decides to be corrupt? It means the money of the public will be looted. We know the story of Brian Hlongwa here in Gauteng, who looted more than 1.6 billion within the healthcare department. Also, the other demand, we demand that the civil society, labor, and the public healthcare users to be involved in the following committees of the NHI. The pricing committee, we want healthcare users, labor, and civil society to be part of that. Benefits committee and the stakeholders committee. And these committees, the NHI board, the CEO, cannot be appointed by the minister. Those powers can be delegated to you as the Health Portfolio Committee or someone else, because we believe that the minister cannot be the player and the referee on the same game. The other demand that we have, as much as we support the NHI, we demand that through this NHI process, the conditional grant on HIV and TB services be ring-fenced so that it is not used for other reasons. Also, as much as you have not yet responded on my second question.
You are making a very last point now.
But you said you're going to give me 3 minutes.
I'm counting. You are not counting. I'm counting time, looking at the time.
You don't keep the promise, Babu Dhlomo. We demand that through the NHI bill, there must be a regulation that forces all members of parliament and the public representatives, service and also people who work for government to stop using private healthcare sector, to start using our public healthcare system so that we can speed up the process of fixing our broken healthcare system. Last one.
Mr. Yawa, imalapha embokweni, just to advise not only you, the whole house, we do not get engaged in an answer question session here. However, I'm going to assist you on the first question as to what happened on the 29th of November. You will go to that table and you'll meet Ms. Machalamba.
The question is, open for the public again?
You will go to Ms. Machalamba. And that's why I'm saying I'm not going to open a question answer. Ms. Machalamba will exactly tell you what I would have said about the 29th of November issue. Number two, we can't suspend the meeting and ask these individual members or give them umbogo again to say, do you or don't you use the public? We will write to you and inform you about that part. I'm not engaged in I am. You go and check King Edward ama records wami. Okwangoku uhambe lapha ke kuDoko uMiss Majalamba. Okay. Ya uzokusiza ngale question yokuqala. Iya kuye nangiya Majalamba ngoku. Akuphendule kulombuzo wokuqala ka29 of November. Okay. Thank you.
Thank you. My name is Madeleine Hicklin, and I'm standing here as an executive board member of the Association for Perioperative Practitioners of South Africa. The questions I have are very simple. We all accept that universal healthcare is a must, but the NHI, as it is presented right now, is clouded in secrecy. We don't know what the package of benefits actually is. We're being asked to vote on a bill that we don't know the ins and outs of. We have a severely constrained and almost broken healthcare system. How are you going to add millions of more people into a broken healthcare system and expect it to work? If you look at the Sizani DA solution, we offer a transparent solution. We offer lower pricing and accessibility on the same level as the NHI, but in a way in which people are able to understand what they are paying for, and if they still want to have private health care, they can. The NHI does not give us that capability. As a theatre sister, as a nurse, we are so incredibly constrained with the number of patients that we have to treat. Adding millions more people into a system that isn't working is going to make doctors and nurses flee this country in droves. We cannot afford to lose staff. Thank you.
Thank you very much. My name is Mlungisi Ncube. I'm just a citizen who happens to have used a public hospital and also at the same time who have happened to use a private hospital. I think the point of departure is that we reject this vague NHI program, firstly because it's going to ensure that the health that we get from public hospitals is going to be a norm across the country if we are going to accept this. If you are going to a public hospital and a private hospital, there is a huge difference. So we are saying to government who are rejecting this, go back, go fix public hospitals, make sure that public hospitals, we have enough medication, we have enough equipment there for people to be able to access quality healthcare there. Leave private hospitals alone, do not interfere, and we are saying that do not regulate the prices. You do not have the power to regulate the prices, because if you do that, you are going to chase away investment from this country, and you are going to ensure that the health care system of this country becomes poorer and poorer. We reject this vague NHI program. Thank you.
Hello, everyone. I'm just having just few concerns about NHI. Okay. There was a discussion around 2011 about NHI Bill, and in between 2012 and 2013, and 2016 and 2017, there were 10 pilot sites of NHI that are already failed because there was no evaluation and monitoring on that framework. And already they were spent 4.3 million on that issue. And my concern is that...
hold the mic in front of you.
Yes.
Don't move like this, move.
Okay, no problem. You heard what I said, I must repeat myself. Okay, no problem, I'll do that. I said there was discussion in 2011 about NHI Bill. Between 2012 and 2013 and 2016 and 17, there were 10 NHI pilot that were not monitored and evaluation on that framework. That they've already spent 4.3 billion on the purse of the public. I'm talking about public money there. Then NHI, I don't know how it's gonna fix the broken hospital because there's no health practitioners that were available on that. I don't know whether you have managed to fix that issue because you can't say you're gonna preserve the quality healthcare without into shortage of medicine, vaccine, and equipment in our public hospital, especially the private healthcare, such as nurses and doctors. That was my first concern. And the second thing on that, on the issue of the period that is gonna take to be implemented. Because on my research, NHI, they said it's gonna take between 10 to 15 years. I don't know how it's gonna take that long. Okay, thank you very much.
Thank you. My name is Lucas Makabe from the same ward, Ward 19.
Bring it a bit, uphakamise babisondele, yeah.
From the same ward, Ward 19. I would like to thank the government for Parliament to come here to us. I'll start by saying this policy is about radical economic transformation to redress the legacy of apartheid. I'm saying thumbs up to the ANC-led government. Having said that, this is a massive long-term project. For it to be achieved, I think the government need to deploy, the ANC need to deploy well-developed production forces with the right skills and knowledge to lead this project so that it's implemented effectively. Every milestone of this project should be evaluated, measured, that everything must run accordingly. Other obstacles that will make it difficult, some people have already mentioned it, that the aging infrastructure, because there is going to be an inflow of patients to facilities. Let's build more hospitals, let's build more clinics, let's fix everything so that the project can run smooth. I thank you.
Good afternoon. Thank you very much, Parliament, to come and to get what the community wants in relation to NHI. I'm from the African National Congress, and we are saying quality healthcare before profit. And this national health insurance, it's going to strike the balance. Those who says that it is only going to address the people for private sector. I'm saying that this is going to strike the balance for the have and not even for those who don't have. We are welcoming the bill. It's explicit with that 11 chapters. At universal, the NHI is a route towards universal health coverage. As from African National Congress, yes, we are having other submissions, especially being a woman. And I want to tell the person who was here before me that I'm having a medical aid, but I have confidence in our public service. I attend our public healthcare services, despite of all those challenges. However, the National Health Insurance is going to correct that. And we're saying that quality healthcare before profit, the African National Congress support the bill. I thank you.
Ngibingelele ubaba uDlomo nekomiti lakhe lonke. Siyawubonga kakhulu lo mthetho osivivinywa ophakanyiswayo ukuthi uzohlomlisa wonke umuntu owumhlali wala eSouth Africa. Even nalaba abaphuma ngaphandle. Kodwa ke ebengicela mina ukuthi bakubuke laba abaholi bethu abaseParliament. Kakhulukazi mhlawumbe njengalabantu abaphuma ngaphandle ukuthi uhulumeni waseSouth Africa mhlawumbe kuyobaleka ukuthi aqhumane nalabo bamazwe ngaphandle kakhulukazi laba kuze labantu abagcwele la ngoba phela iSouth Africa isomhlaba uhlangene bazokwazi ukuthi nabo bafaka isandla ukuthi le National Health Insurance ikwazi ukuthi nabo bahlomule njengoba bela ezweni laseSouth Africa. Bese ngicela ke mina okunye ukuthi mhlawumbe uhulumeni akakabheke indlela onesi abasebenza ngayo ezibhedlela zethu njoba futhi njoba kuhlongozwa lo mthetho osivivinywa bukhulu ubudedengu obenziwa amanesi emtholampilo isibonelo nje kahle kahle kunosisi eKZN kwaNongoma obelethele eTexini ngenxa nje yamanesi updating angafuni ukwenza umsebenzi wangendlela. So bengizocela nje ukuthi ukuze ezempilo zisebenze kahle akagxilwe kakhulu emanesini ukuthi enze umsebenzi wawo ngendlela eraght. Ngiyabonga.
Sanibonani.
Let me greet the chair, Dr. Dhlomo, and thank you for coming here. The NHI is gonna be a good program, is gonna help us. But what we propose is that our government must consider the issue of foreign nationals. Our government must liaise with their governments because this program of NHI is derived from the World Health Organization. So it will not be just an easy thing to dismiss those foreign nationals. And the government must also consider the issue of staff, the capability of nurses and their quality service. Sometimes you get a person here who is a nurse, who is expected to give a service of a particular quality level, but you don't get. Sometimes you see someone who is at hospital who has been there without receiving a particular help, even people in Guanongo.
Sanibonani. Igama lami uLakhi Buthelezi. Baba uDlomo bengizocela mina ukuthi i-medical aid tina abantu esingasebenzi or abantwana ngeke si-afford ukuba siyibhadale. Ngiyibonile i-pamphlet la but ayistate kahle ukuthi kubantu abangasebenzi abangatholi lutho yenzani yona i-medical aid. That's one. Then number two, ngicela futhi ukuthi abo doctor. Okay. Ngicela ukuthi futhi lapha ezibhedlela kubo doctor mokuqhamuka indaba yokuthi umuntu wenziwa i-operation and then ngicela ukuthi kube khona ama-qualified doctors, not ama-student doctors, because kune problem esiyitholile thina ifamily yasekhaya sihanjelwe umuntu ngendaba ye-operation and then lo muntu lo abo doctor labo kade belapha ba-operator umuntu twice a day. Angaze ngayizwa lento le before. So we were deeply hurt ngaleto le. Then saze samngcwaba and then ke saphelela lapho. Ngiyabonga.
Okay.
uzothi tolika ngicela ke mfowethu uye lapha ya ku-HOD uzokulekelela check le clinic noma isibhedlela lapho khona umuntu wasekhaya owahlinzeka ka twice nale ukhulume ngayo uqala ukuthi iyalapha nje babulukhela uyangala.
Good morning, the committee and the chairperson, Dr. Dhlomo. My name is Lucky Mthethwa. I want to clarify one thing, because the NHI is a good thing, but there is one area the pamphlets didn't clarify. The issue of affordability, in particular to us as elders. It doesn't say at what threshold of payment do we fall under. So we would want that particular clarity on the issue of pricing or affordability. Then another issue that we need to look into is the issue of hospitals and doctors. It is not desirable to have doctors who are students to service people in hospital. We need qualified, experienced medical doctors. For an example, in my family, we once lost a family member who had undergone an operation. And that particular procedure did not go well. There was some kind of negligence because that person was operated twice on one day, something that we have never heard of. Thank you.
I want to greet everyone here. My name is Diana Khatebe Khoza. Do you hear me? I would like to greet everyone here. My name is Diana Khatebe Khoza. I'm living at Ward 15. I think today the ministers are here for health. Really, some of the things as Patum Pagati. I visited someone called Ward 61 last month. The woman passed on. I think Kiki Ward Yabatuba cancer ele. Pleke hayashweka. Kikupa di minister hadia ko spetle, especially sa runa sa perekwan. Lifite ko di ward in skila chiga ko new building. Kenan kamo har hospital ha holo lifite ko 61 ko unan le batho ba cancer teng. Ha se khatle spetle sa runa. Una ni mistake ko ward ko go pepiswan teng. One day the lady una ilo paper mola, I know that woman. Ho thola itse doctor wa mo checka ha fetsa o mo checka doctor o tsamaile ka file. Patient e ju tshwantse e pepiswe. The nurses had to mo pepisa because failure high teng mo. Ke bohlaso ba pele, and then that woman, she's still sick even today. Diposo tsa spetlele sa rona ha di yo right. Re lela tšhelete ya rona ya mmuso. Mmuso o tlo siwa ke setšhaba ho fitlhella neng. Service re tla e thola mo tšheleteng e feng ha batho ba sebetsang ba tlohela batho ba lemala. Ke a leboha.
On top of what she has already said, she says she's concerned about dirty hospitals. She's also urging the minister and committee members to please, when they do their visits at hospital, to please go inside the wards. Don't just go and leave without going to the wards, and observe for yourselves what is happening in there. She also mentioned the problem with the ward in midwifery, that once a doctor left with the file of the patient, and the patient could not deliver, and that patient is still ill even today.
Okay.
Please, can we remove the mic from that lead and give it to our participants? They will move the mic physically to the person behind them. Isuke lapha ngoba akekho umuntu oyimanager continuous. Ayiphume lapha ya. Ayibambele esandleni. Ngoba akekho umuntu oyabe lapha ayimanage all the time. Ayinikeze the next one behind.
Okay, sanibonani dumelang absheni. Libitso la ka ke nna ke di bone Montsojang from Ward 49. I'm a ward committee member there. I welcome this NHI. I welcome it. But my main problem, last year, there were people who came from the parliament, just like you are now. And then they wanted us to tell them about our problems. But we didn't get any report back from them. So I don't know whether if you are here and then we give you promise, maybe people will go and write everything that they needed the clinics to be done. But now my main problem is Fisherville, we are using the mobile clinics. Ne? I don't know whether this will come to us because now, even where the people are more pleke batho ba kena mo yona there, more reception. Arena pleke, batho ba pregnant, they are standing there. So I don't know hore ha le tla ka ento, you will come le tlotla le tlo lokisa the problems that we are having, or you will only come with the NHI insurance mo le fela na. That's the main thing e leng hore ya ntshwenya mo moyeng wa ka, because rona mo re dulang teng it's a disaster. Clinic ya rona is like it's not a clinic. So we've been fighting to get a proper clinic. Gore re tlo kry everything e leng hore ya etsahala, but now we don't get anything. Like even you come with the measles and everything, ne? It's a disaster. People they even you libitsa batho hore ba tle ba tlo etsa di measles. And then Rona as the ward committee and then the clinic committee will deal with it. We remobilize it to get Batu and then remobilize the credit clinic and everything, or this thing is coming. But my main problem, listen, they can eat, there's nothing. And about the clinic committee, they don't get anything. So neke kopa, or before litisa din totetwan and lete, lukisang our clinics because it's a disaster. So we welcome it because it's nice. But now, we are losing the nurses. We've already lost 3 of the best qualified nurses. Now we're using the student nurses. And then what is going to happen? Please.
Can we have another mic roving that it must sit with the participants, and the interpreters will have their own mic, please? It takes longer if you do it that way, okay? Can I request, sorry, before the following, this car is blocking the exit, and there is a car that must go out. The registration number is FN 09VVGP. It's a Toyota Corolla that is silver. Please, umnikazi wale moto ivimbile FN 09VVGP, Magaisuse ivimbi moto ezifuna ukuphuma. The previous participants, if she could maybe stay until we finish, or I might have to see her, but just to indicate, the presence Yama leaders anje a province is among other things listening to challenges that are immediate. But I thought I was going to address that as we close. Those are things that we want to hear, both nationally and also provincially, because we want to process them. So, Department of Health,
she is Kidiboni Mutojani from Ward 49. She's a clinic committee member. Her worry is that they're using mobile clinics in their ward and there is no space in reception. You'll find that pregnant women are standing there without having any seats. Their clinics do not offer proper services, so she is appealing to the committee that before the NHI could be implemented, please make it a point that the clinics are fixed and that they also have the qualified nurses have left the service because they could not be taken care of. Even student nurses are also leaving as well.
Modula stulo le boetapele bo re okametseng today. Nna ke Phineas Malahlela ke tswa ke le ko Mapete. I would like to really appreciate the parliament coming to our area, bringing this bill to us. It is much appreciated, and we say we should have more of this kind of sessions. But I would like to raise this as part of the ingredients that you should consider going forward. One, the decision that was took in 1983 by the then government of moving the nursing scope from the nursing colleges and moved it to universities, it's now making us suffer. So whenever you are starting to look into amending certain elements within the NHI, consider that because of one. Currently, if you look at the nursing colleges that we are having, in Gauteng we have only 2. It has so much queues that need to be doing the intake of the nurses. One, for an example, if you go to Bara has shortage of nurses of over 3,000. If we can now open those colleges to individuals' hospital, it will alleviate this pressure of this attitude into our hospitals, this fatigue of the nurses, and then automatically it will give us what we want with this. 2, in terms of this bill to be effective, maybe we should start looking at how measurable within our community will it be. For an example, according to the ingredients that we gave, that who will be benefiting within the bill. 1, if we are speaking today, how can I go to Bara tomorrow and start looking at the deliverables? 2, the attitude of our staff, hence other colleagues, they have highlighted that. We really appreciate this kind of thing, but if we can address human resource, therefore now that will assist and it will speed up the process. We want this by 2026 be effective and we should feel it in the ground. Thank you.
My name is Sisanda, and I'm a robot. I work in the region of Region G in the south of Joburg. I came all the way to ask about the NHI. When we went through the document, it said in Chapter 1, the Act and the Purpose application applies to the health establishment, excluding military health services. Then when we looked at it and we asked ourselves as community care workers, as we are part of the health system, are we part of the NHI? For the long time now, we have been neglected as community care workers. There is no improvement in our work conditions. We are still getting a stipend. We're also asking if this NHI will it also include public servants that are receiving stipends, who are the workers who are working for the Department of Health but still are under Department of Health but are not getting any salaries. And we're also asking if the Department of Health, we're also pleading, in fact, that if the Department of Health can hire community care workers, then the NHI will be effective. Thank you.
My name is Pinky Zulu. I'm from Shawela Extension 3. My concern is about Shawela Clinic. In Shawela Clinic, it's a provincial clinic, but still, there's a project that is in there that is used by Dr. Musa. What's happening there? Dr. Musa is offering the community of that ward services like you don't go to, he takes his community, community health workers to go to, they're doing door to door. Then after doing door to door, but there are some members who don't get that services. So we've got elderly people who maybe they go to Shawela Clinic for chronic medication. They're supposed to come there every day, whereby people who are going to Dr. Musa's clinic, which is inside Shawela Clinic, they got community health workers who go and give those medication to those old people. So now the problem is saying, Dr. Musa is saying that the government doesn't want to help him so that he can provide for each and every ward member in Shawela. Thank you very much.
Kgotsong batho ba baholo. Ka lebitso ke Raskepe Nyamati ke hlaha Fontaine. batho ba etsang ntho e ntle tshwanetse ka tsatsi le leng o ko ba tlotle. A ke lebohe kelello e le tlileng ka yona e ntle yona. Se ke ipotsang sona ke hore na ha se e sebetsa na e tla re sebeletsa hantle na. Ho tea ka mohlala a re shebe mahaeng. Jwalo ka Boqwaqwa, jwalo ka bo Bethlehem, diplekenyana tseo. Hore na ebe tsona di tla kgathallwa na hore le tsona di kgone ho tsamaya ho thola NHI ka tsela eo mohlomong Gauteng e tholang ka yona, ka tsela eo mohlomong Limpopo e tla e thola ka yona. Hoba jwale diplekeng tsa mahae ntho re nahana hore re lo e etsa ha re fihla mole a re sa e kgathalla. Batho bale hore taba eo batho bale ba e etsa ka mokgwa o tshwanelehileng ka teng, ka molao, ka mokgwa o ba tlamehile e latela ka teng, a ba e latele. Ya bobedi, bomme le bontate ba tsoha hoseng ho lata ho ya ditleliniking moo. Na le tla e lokisa tshubuhlellano e re tholang ditleliniking ka se sebaka ha sona le NHI, hobane ke nahana hore mafatshe a kantle jwalo ka bo Lesotho, Mozambique, Zimbabwe, batho bao ka lebaka la ho utlwa hore South Africa hona le seo e se improvileng, ba tlo tla le bona di tlale ho feta hona jwale. Jwale ka ba taba eo le tla e lokisa na ya hore tshubuhlellano e fokotsehe le hore ho eketswe dingaka le tsona ditleliniki. Ya ho qetela ene ke batla ho e kopa, ke batla fela ho support-a batho ba reng ba buang ka stipend. Ha re hlakisa hore ebe e hlake jwalo ka solo hoduma le ho atata. Hore ntho eo e atlehe tlamehile ho be le batho ba thusanang le mmuso ho tloha fatshe kwa ba bitsa ba re ho tloha fatshe hore e tle e kgone hore e atlehe. Jwale ke bone ka batho bao ba sebediswa ka tlala kapa le hona moo ditleliniking di-committee tseo tse teng ha o le tie ya tie ha ba e thole batho bano empa ba etsa mosebetsi o moholo. So re kopa hore le re thuse stipend se be teng.
Ntate started by saying that credit should be given where it is due, that this idea of NHI he welcomes it very much. But then the concerns are in rural areas. He wants to know if in rural areas attention will also be given as it is being given here in Gauteng. He mentioned some places in the Free State, Qwaqwa and Bethlehem, whether this NHI will be implemented there as well. And then he's also concerned about people who should implement the policies of government, that you have a good idea, but people who implement this are not doing their utmost best. So that should also be considered. And then he is worried about long queues that are going to be there because people from other countries, after hearing that South Africa is going to implement an NHI, they're going to flock to South Africa. How are you going to address that problem? Is it not going to create more problems of long queues and overcrowding? And then he also mentioned stipend, that people at grassroots level, he suggests that they should be part of the committees of implementing this NHI.
Thank you. Right. Ikama wapet niko Makhubela from Ward 10, Protea South. Ngifuna ukuqala ukubuza ngale ye-interpreter. Umuntu ma ekhuluma ngesilungu kunabantu laba bangasazi isilungu but an interpreting ngelimi lethu ukuthi sikwazi ukuzwa. But uma ngikhuluma ngesizulu ufuna uku-interpreta ngesilungu. Lo mlungu naye akamamele ukuthi sikhuluma sithini. Ngicela ukuthi ibe fair. Abogogo bethu abasazi isilungu. But makhuluma ngesilungu an interpret ukuthi sikwazi ukuzwa ukuthi kuthiwani. Mara mangikhuluma ngesizulu u-interprete lo mlungu for what reason?
Isizathu ukuthi ama-committee ama-members ala abantu ababhalayo la abangasazi isiZulu kufuneka bazi ukuthi kuthiweni yilento ebanga ukuthi ke ngoba phela manje thina silalele nina kodwa kunama committee members angasazi isiZulu nesixhosa yileso sizathu kwesitolike isiZulu siye singisini iloko ithina esilaleleyo asisithina sonke sisazi isiZulu la.
Siyabonga Dr. Nomos Ropa. 11 official language in South Africa, you must listen. Umtolokele wena seduze nayo. Ngiyabonga. Mina Dr. Siyabonga kakhulu nge-NHI. Dr. Bandile Masuku wala eGauteng uloku busy naye ehamba naye. Mina bengithi manizala uthi you are going to implement because kudala kukhulunywa ngayo. Hence people today most they are not voting the ANC because of what? The ANC got good policies but we are afraid to implement because maunga check NHI kudala lento iqalile but it's still taking time. You say 2026 maybe abanye sizabe sifile singakayifikeleli ne-NHI. So sicela ukuthi uma kukhulunywa ngento let's implement. Let's not be afraid to implement. Hoping ukuthi the majority voted the majority party. Manithatha lento lesithi asiyenzeni fika nibeke nithi nice ayenza. Because tomorrow the other party, it can be DA or EFF, mayophatha lapha immediately mabangena they implement. Meanwhile yourself you are afraid to implement. You still want to say can we implement? Because sinivotela ukuthi nibe lapho nikwazi ku-implement ama-decision wethu. Izikhulumi zithethile Babu Dhlomo. Abantu bangaphandle abo brother wethu from the neighboring country ibona abagcwele labasebenzisa ama facility wethu more than thina. Can't sometimes sithi asiclassify abantu sithi akube nama register ezibhedlela zethu so that we see how many foreign nationals do we have and how many South Africans are using these facilities because kwamanje when you implement i-NHI njengoba inkokheli ezinye zishilo bayajumpa baze South Africa because there is better service and better health services. So that's why when we use the NHI thina abantu bala eMzansi do we fit in that system? Because definitely sure kwamanje mawucheka emabordereni bo Lesotho bo Mozambique bo Swaziland those people bayajumpa bangene baze emaklinikhi wethu because everything is mahala. Bathathe babuyele kuphi emazweni akubo bese sithi imishwanguzo thank you, imishwanguzo yonke iyaphela ugovernment akakwazi uku-afford abantu base South Africa. Meanwhile foreigners they take our medication to their countries. Thank you.
My name is Apetniko Makubela. The first thing I want to check, why don't you interpret for other African languages rather than interpreting from isiZulu into English? What about these other languages? Because you disadvantage other African languages and give advantage to those who speak English. Another thing, Dr. Dhlomo, is that when you come here, after Dr. Masuku has been here, when you come here, we thought you were going to tell us that we are now implementing NHI. But we are not implementing, we are still engaging. The ANC has got has got good policies, but those policies are not being implemented. And also, many speakers have spoken here, Dr. Dhlomo, in particular in relation to the issue of foreign nationals receiving healthcare services in this country. When we implement NHI, you will see that foreign nationals are the ones who will jump the queue, be on top on the list to receive these healthcare services. Because if people are like from Lesotho and other countries, they just cross the border, They come to South Africa, receive all the medication, take the medication to their countries. Thank you.
Thank you very much. I'm happy to have this time today, all the house today. Dr. Dhlomo and all the house, I'm very disappointed in this 2020. What is this 2020? Yes, I'm a community health worker. I started this work when I was young and strong. But today I'm running to be 55, but I'm still getting stipend. In the old government, the white government, in this time, I'm supposed to get my benefits, my pay, everything. But now I'm very surprised because ANC's got a good policy, always is promising a good thing. But I'm still getting a stipend. I'm going down to the house for the household and give for government a report. But I'm very surprised, I'm still in the stipend. There's a small children finishing the schools. They are not working. Why? Because in the hospital, there's a shortage of the sisters. Sisters, they are working, but they are working under pressure. Why they don't put children to the hospital? Why they don't take even, we have experience. If I can show you how much a diploma I have, but I can't go to the, every time when I go to sign the contract, I must go to make CV, I must photo certificate, I put on HR, but no action, stipends. How long is going to be appendix? I want to know how long. In this time, I'm not fighting. I'm sorry, Chair. No, guys. We are not fighting, please. Let's respect our leaders. Me, I'm delivering the speech. If you clap the hands, it's like now we are making it what you call? Okay, all right, sharp. Okay, I'm coming. Doctor, I think that today, take this message. We want the benefits. You are the community health workers. You are the one who go to the household. I know that HIV, you are dealing with HIV. People, no more people going with a crivite to the hospital because people, they wake up, they can work. We put education.
Okay.
They take ARV, everything. Thank you.
Imag. Ngoba nathi sombuzo uhulumeni awuhlala uqala uhambe uyela phezulu ka Professor Lukhele. Ngoba angikholela cha monganikeza umbhobho ungahawulishe othula nje angikholelwa ukuthi ayikho impendulo noma yinhle noma yimbi ekhulunywa ngalolu daba awusondela phezulu ka Professor Lukhele cela uye khona nathi sokubuza.
I'm sorry, doctor, to enter in your mouth. I respect you so much. I think last week it was members, they were going to Pretoria, fighting for the rights, that they need a permanent job. Because these people, we've got power, they still want to work. But no action. We don't want any more toy. You want to be decent, sit in the table, give our rights, everything. So now you refer me somewhere else. Until when, doctor? Please, action.
No, Ozala, no. Sinasi isizathu sokuthi nathi sibize i-department izosichazela ukuthi ukuphi lo mcimbi wama stipend. Kodwa ngithi nawe ephuma la endlini utholile ngoba esizokuzwa ngabo uzokutshela nawo namhlanje. It's a national program efuna silandele. Okay.
Oh. Sanibonani. Igama lami ngolindi weGatebe. Ngihlala la eWard 19. Bengicomplaina ngeclinic iShawela clinic. eShawela clinic njalo uma ufikile uhlala isikhathi bakuhlalise mafike ngo8 uyahlala uhlala. Emva kwaloko masohleli bathi abo doctor abekho. Number 2 nomzukulu ngimhambise iSt John's. Elihlo lakhe alikho right. Mangifika lapha yana bafike nje bamcheck ngibachasela ukuthi inkinga yabo yini yelihlo. Bathi hayi akana next. Banginikeza imithi. Ngabuyela futhi ngilanga la last year December. Mangifika khona bathi ngibuye ngakusasa. Azange ngibuye ngakusasa ngabuyela nge11. Nge11 mangibuyela bangitshela ukuthi estembini sabavalile. mele ngibuye futhi ngakusasa azange sabuyela manje nginenkinga yokuthi umntana ngoba uhamba isikole and ilihlo lakhe liyaphanja liba lincane so angazi kumele ngenzeni bengicela usizo.
Thank you, Chair. My name is Lindy. We're from-
Iclinic mama, iclinic yakho igama layo yini? Shawelo. Shawelo.
My name is Lindwe from Ward 19. I had a problem at Shawela Clinic. I went to that clinic because my son had an eye problem. When I got there, sometimes they said that there are no doctors, there are no nurses. So now then I took my son there, they examined him. After that, they said the results show that there is nothing wrong with the eye. But my big concern is that my son is attending school and he has got a problem with this eye. Thank you.
Good afternoon to all the members of the Parliament and the House at large. My name is Tandile Meiswa. I come from the Revelations Church of God led by Prophet Khadebe. As we all know that the NHI is the resolution of the ANC which fosters universal access to health care. The current reality is that the current healthcare system is still a reflection of the apartheid legacy. Why do I say that? The current life expectancy still reflects the apartheid legacy as it is higher for white people compared to black people. It is still the reminder of the injustices of the past. So the NHI provides for all South Africans to have equal access to equal healthcare services and therefore a better life expectancy for everybody. In our support to NHI, we should seek and also make it a better product for everyone. And here are a few suggestions that we have made. We should remove the part of section 8.2 that says through a voluntary medical insurance scheme or through other private insurance schemes. That should be deleted because this part of the section contradicts with section 33 of the bill that says the future role of medical schemes will be complementary, which says that the medical schemes cannot cover same services as those of NHI. This part will create an environment of duplicative cover that will undermine the principle of NHI as a single fund and social solidarity. The second point is on page 31 where it says amendment of legislation under the Medicine and Related Substances Control. The problem with this part is that it says NHI fund, by the NHI fund buying medicine and products at single exit price. The NHI fund will be paying too much money. As such, this amendment needs to change and read as follows. The transparent pricing system contemplated in subsection 2 shall include a single exit price which shall be published as prescribed by the Office of the Health Product Procurement contemplated in subsection 1. And such price shall be the only price at which manufacturers shall sell medicine and schedule substances to any person other than the National Health Insurance Fund established by section 9. Thank you.
Enza njeke ndodakazi ngoba lento yakho iwo subsection technical awuye kuleli yatafula lapha uqedele khona ke bakwazi ukuyibamba kahle.
Chair, thank you very much for the opportunity that you have brought this document to us. Chair, let me first congratulate your committee for working on this committee on this document. This document looks very good, but to implement it's another thing. Chair, what I was going to ask is, and I went straight to page 50 of this document because I was looking for the answers why you have this document. I wanted to know the reasons why this document. And page 50 reads like this, 5.2 in page 50. The goal of the National Health Insurance is to move towards universal coverage by serving a strategic and active purchaser of personal health care services and by ensuring that the entire population and not just the particular groups, are entitled to benefit from needed high quality health care. Now my question, Chair, is, if I'm struggling to get into Eden Vale Hospital or Hillbrow Hospital, can I run down to Brentest Hospital and get services without being asked, you're from Mozambique, you're from Zimbabwe, you're from other countries and you're not black enough, so go back to Hillbrow? So that's question number one. And question number two, Chair, let me be very honest with you. This looks like a scam. This document is almost a scam. And I can tell you, Chair, you said we'll see the fruits of this document by 2026. By 2026, Chair, this document will make the arms deal looks like a grade 7 pocket money. Thank you very much.
Sanbonan Molweni, igama lami nguNandipha Mbhekwa ngisuka eProtea Glen eWard 13 ngiward committee. Benginesicelo for abahlali baseProtea Glen. EProtea Glen sine clinic encane, maybe 14 rooms. Kunabantu abaning from extension 1 to extension 29 eProtea City whereby kusakhiwa izindlu. Besicela nisakhele iclinic because ayikho neprivacy eProtea Glen clinic, ichronic ila, ipregnancy ila, abantu abagulayo abantwana siyanicela nisakhele iclinic incane iclinic yaseProtea Glen. Then la sibonge number 2 sizobonga ukuthi nisandisele ixesha uba nenze 7 to 7. Kodwa for thina eProtea Glen kuyafana ngoba akunamanesi. Uthole kwiside le pregnancy abantu abapregnant bagcwele bazongena ngo5 bayoze bajikiswe babuye nakusasa nangelinye ilanga. Besicela namanesi nisengezele nestaff. Bese number 3 eProtea Glen kuhlalwe kuthiwa akuna medication iphelile. Uthi mawuya eShawelo clinic bakujikise bathi hayi sithola imithi elinganayo buyela eProtea Glen. So for that bengicela isecurity for eProtea Glen clinic because ayifani namanye ama clinic mawungena uyipatient uyaseshwa or staff uyangena nje uyaphinda uyaziphumela nestaff sakhona. Bengicela nesecurity yakhona ibe tight because uthi why imedication ishota siye kwi-public clinic ngoba asinamali bese ubhalelwa phansi kuthiwa hamba othenga into so uzoyithenga ngani ungenamali. Bengicela nisisize kuzo zonke lezo zinto lezo. Ngiyabonga.
Awungisizeke uye ematafuleni amabili uyalela tafula le Department of Health eProvince. Uma uqeda lapho uye kulela tafula ushiye imininingwane yakho ama details wakho lapha.
My name is Chandiwe from Ward 14. I'm a ward committee member. We got a problem there, Chairperson. We have a very small clinic and people are too many in our area. And the number of people is increasing. We are pleading with you to increase the number of buildings or to erect more buildings in that clinic because the space is too small. The toilet is here, everything is together, even the privacy for those who are pregnant and other people, there is no privacy. And sometimes you get transferred from that clinic to Shawela. When you get there, you arrive early, you spend more time there on the queue until late in the afternoon you leave without being attended to. We also request that the security issues be looked into because when you go into that clinic, there is no security measures, you don't get searched, people are just walking in and out, members of the public and staff. We really plead with you.
Thanks. Chairs, thank you. Committee yako ne committee yako. Lapa man nami mhlala nguGodfrey Mashinini ohlala ngo-33
Ungakhombi ngombhobho bamba yom.
nguGodfrey Mashinini ohlala lapha e33. Sine clinic nathi lapha le clinic ayina doctor ngesisikhathi phela nemithi besicela nilungise nalapho. Kukhona le party lena ethi irrespective of
igama le clinic
igama le clinic umuroka
Moroka Clinic. Ikona lenda or lena irrespective of the province in which you are located. Bengithi nilungiseni nendawo ethi irrespective of the township ozobo uya kuyo, because if at all ngithi ngiphuma e33 ngithi number yase 33 emfulo eshawela abangithathi, ngifuna nilungiseni nalapho. Lapha ku complimentary cover me, it means elento lapha ku complimentary elento ikhuluma ngoku reimburse by the funds, it including any top up. Ngicela nje clarity lapho. Thanks.
My name is Godfrey Mashinini from Ward 13.
Uya bab mashinini yalapha yakulela tafula. Yalapha bab mashinini lapha yakulela khona.
From Ward 33, we have a clinic there called the Moroka Clinic. In that clinic, there are no doctors, there are no nurses. Sometimes the clinic runs out of medication. And sometimes when you go there, you don't get help. If you go to other clinics like Shawela and others, they don't assist you. So I plead with you to look into the issue of people receiving healthcare services, irrespective of the township or area where they come from. Because sometimes you are sick, you go to a particular clinic. They send you back home to say they cannot attend to you because you are not from that particular area.
Yeah. My name is Peggy Manigivan. First of all, I would like to thank your committee. First of all, I would like to thank your committee for coming to our area to listen to our concerns, and also to thank the general community members that are present here. Can I be given attention? Your members are busy with their phones. Please, it's been going on since. No. Look, can we be respected? We left our respective homes to come here to listen to you, but you are busy with your WhatsApp. It's very disrespectful. Please, look, can you stop, please? Comrades, I'm saying we are here, we have left our home, we have elderly people here. You didn't even arrange food for them. So all I'm saying is we support the cause of NHI. However, in terms of infrastructure, because those are general, I'm saying in terms of infrastructure, we have picked up that there are concerns, that we need to look upon the issue of infrastructure. Because most of the speakers raise issues around the issues of infrastructure, that at this stage, a moment in time, in terms of our infrastructure, our government is not doing well. There has been a lot of complaints by many speakers. And I'm saying personally, Tinango, that if you have a chance, go to Johannesburg Gen, of which is now called Charlotte Macleck. The infrastructure there is bad. The lifts are not working. Johannesburg Gen, Charlotte Macleck. And it's now 25 years post-democracy, but we're continuously failing our people. I'm sure Mandela, wherever is sleeping now, he must be turning in his grave. Because all these concerns, 25 years, no one have ever thought that fellow Africans in particular would be complaining about the same things. And we've been to a series of these discussions, but we now more of talk shows than any other thing. Dr. Bandile invited us, we came. It was more talk with less implementation. Can we start to take your team to take our issues seriously and start to implement? Because we really have a crisis as a country. You know, we're now becoming a banana republic. Look now, even ESCOM, we've got load shedding, things that were not there during the apartheid regime. And so we need to be honest with ourselves and ask ourselves, where have we gone wrong? Our health facilities were far better during the apartheid regime. And we need to be honest to ourselves that as a ruling government, we are failing our people. The levels of unemployment are sky high. We continue having useless commissions that will spend 320 million, whilst our people are still in a state where they are still poor as I speak today. Unemployment is high. We've got shortages of doctors, unqualified.
Your time is up.
No, but this is what you do, comrade. Dinango, no. Allow us to speak. You didn't even arrange food for all the people.
Yeah,
Please.
if you have more points, we accept them. You put them on the table and give respect to the people behind you.
Then this is more of a tick box than any other thing. Because
can't-
I thought this platform would allow us
No
to
10
engage.
minutes per speaker phela. Noma kunjalo. We allow you to add other points lapha etafuleni. Okay.
Afternoon, members of parliament. We appreciate your coming here. My name is Louise Amwepeng Mudikwe, and I'm the acting provincial secretary of COSATU in Gauteng. We appreciate and we welcome NHI. That is the first thing that we need to indicate. Because out of our own research, we realize that most of the workers cannot afford the cost of the medical expenses as at now. You can talk of your domestic workers, you can talk of your farm workers, and more so in the private sector. But again, in the public sector, when it reaches your June, July, the medical benefits are already exhausted. So generally, that is something that we appreciate. And we would propose and recommend that we look at speeding the process, because 2026 is a bit too far. But we understand, and one would give an example. Section 4, subsection 3 of the bill, that talks to the asylum seekers and illegal migrants, versus section 28 of our constitution are a bit contradictory to each other. And we are requesting that you look into that, because as long as we are unable to get the right move in relation to monitoring our foreigners, and I'm not saying illegal or legal, I'm saying foreigners in South Africa, we ain't gonna be able to get as to what is it that we want to achieve in making sure that we get all the South Africans. And when I say South Africans, I'm still going to reiterate, I'm not talking about foreigners or non-foreigners. I'm talking, the constitution again of South Africa is very clear. Whoever is in South Africa qualifies to get all the benefits. So let us not fight and be moved or lose focus on what we need to achieve. The last one would be the one on, just a sec, making sure that the clinic, the hospital, all the health facilities are corrected. That is the truth. What has been said is true. It's fortunate I'm staying in Bramfisher, and most of my time I use public health services to make sure that I understand what is happening. Shawela, it's still a problem, and service needs to be improved, because without service from our public service employees, we ain't gonna get anywhere. Nyabong.
Okay. Can you assist to move to that table, especially about the subsection section 28 and the other one that you quoted, subsection of the bill? Ungishele leyo document lapha kule tafula. Thank you.
Good afternoon, Dr. Mbonseni as the chair, together with the people that you are leading. My name is Itumeleng Molanto. I'm from COSATU also. Comrade Chair, one of the issues that we had wanted to raise is more or less covered by a previous speaker. The issue on page 10 that speaks to cost coverage. We are once again reiterating the fact that that lettering of at point 2 that says through a voluntary medical insurance scheme or through any other private insurance scheme, that part must be removed from the bill. Because our understanding, if you look at page If you look at page 19, clause 33, it says, once national health insurance has been fully implemented, as determined by the minister through regulation, medical schemes may only offer complementary cover to services not reimbursable by the fund. I think over the course of time, as you are coming here, we will have realized that the Competition Commission Tribunal released some information that deal with the practices of medical aid, especially towards people who are non-white. So our belief is that the issue of medical aid schemes should, in essence, be scrapped because NHI is coming. But then we understand that as much as we are living in a society that is not pro-socialist, we need to accommodate those particular what you call. But the NHI's bill, as and when it is implemented, the NHI insurance, the diseases or coverage that it offers must be such that that is not offered by it, private must then be in a position of offering that. The other issue, Chair, that we would want to talk to is on page 20, section 38, the Office of Health Products Procurement. Chair, our understanding is that, if memory serves us well, the Polokwane resolution in 2007 spoke about a state pharmaceutical company. Now, from what it is being presented to us, it seems as if all procurement will be procured from the private companies that are selling medicine. What then happened to that pharmaceutical company? That must be established by the state. We are urging you to add that so that we are then in a position of procuring all the pills, all the medicine from a pharmaceutical company. We thank you, Chair.
Thank you.
Kunabaxoxayo nje continuously non-stop la. Kungcono ke mebefuna ukushawa umoya sibadede labantu bawushawa umoya babuyele ngaxoxa. Liyakhona i-desk yase Gauteng Health thathani ama issues without making so much noise that is now dealing as if that is the main meeting of the day.
My name is Wanda Pendu from Nehau. We are in full support of NHI with the view and belief that it will improve the lives of the working class and the poor. Section 13, 5P of the bill indicates the board members must have appropriate technical expertise, skills, knowledge, and so forth. This is contrary to what the white paper is mentioning about labor. On other expertise that is required by the bill has been excluded. Nehau suggests that these requirements of expertise in labor must include and indicate on white paper. Section 15.3, number E and F indicates the functions and powers of the board as to advise the minister on any matter concerning terms of conditions of employment, fund of employees, matters of collective bargaining. This matter will require expertise of labor law and labor relations on the board. Section 20, number 2B of the bill outlines the responsibility of the CEO, which includes organization and control of the staff of the fund. We recommend that the word control in section 22, number 2B, be replaced with management of staff. Section 20, number 2E, outlines that the CEO will be responsible for the establishment of an investigation unit within the National Office of the Fund. Concurrently, Section 2(3)(I) says that the CEO must establish a risk and fraud prevention investigation. The bill does not stipulate the role or function of the risk and fraud prevention investigation. NHI is of the view that this creates confusion and duplication of functions.
Professor yena qobo nje ayangezi kunina lapha ekhoneni anginazi nina nisuka ku department. Professor zoyiqoka ngoba ubuya be specialist ukuthi yini le asuke yele ayela. Nangu ahlala eduze kwakhe nani nizolekelela kodwa ke akayikhulume no prof lento akhala ngayo.
Mandibulise nje indlu ngobubanzi ndithi Camo Queen. Dear Chair, my name is Oscar SB. I am the chairperson for traditional health practitioners, otherwise known as Abelaphi, Iznyanga, Izangoma, etc. In the province. Tina, in general, we are in support of the NHI. However, we have concerns. There is an act, of course, I'm sure you're aware, that governs us, Act number 22 of 2007, that seeks to say we establish the council that shall regulate our practice and the practitioners. Currently, that act has been suspended, of course, for various reasons. Amongst them being the very same challenge that I believe we're going to experience with NHI. NHI has got good intentions. Previous speakers said our country is very good in terms of policy, but they seem not to be speedily or expeditiously implemented. What I mean by this, Chair, is that you see, in as much as there's an act for Tina Abelapi, you then have other opposing acts. For instance, the Witchcraft Act. For as long as those acts are there, they seem to undermine this very same act that legalizes us in practicing. The other concern that we have, you see, in order for me as a practitioner to be able to execute NHI work, I need to be accredited. And part of that accreditation says that I need to be registered as a THP in South Africa. Now, according to my knowledge, the council is there. The registrar has been appointed. He's getting a salary up until this hour. And yet, in this whole province, there is not one single THP that is registered. I'm just saying, let's have a question mark there. Because currently what is happening is that our fellow practitioners are being abused by the cops, the hawks, you know, and understandably so. I mean, technically speaking, I'm standing here claiming to be a THP. I go back home, I help a client, Yabon. I'm doing that illegally, if we were to be technical, because I'm not registered. I'm not a registered practitioner. So we are saying that we would appreciate for government to sort of align these policies, you know, so that they favor us. And I make reference to a document, a policy document here too, that was suspended 2008. Can we look at that as well? Because it also speaks to us as practitioners. Then finally, Chair, we would like for THPs to also sit on decision-making bodies, the NHI. For instance, your pricing committees, etc. You know, I don't believe something should be done for us without us. I thank you.
Yeah, ngiyabawela ukuthetha nawe mayiphela le meeting uzobe usekhona. Kodwa ke kuxhomekeke kutheni ixesha lakho lihamba njani na. Yeah. We are now starting on this line. We would like to indicate that we know it's a weekend, there are pressures. We respect that you would like to be part of the meeting right through. But you also have opened up the slot for any other person or group to say, People were coming with us from the area where we come from, have spoken, and we have a pressure, we'd like to leave. We'll accept that. But if there are people who would like to leave, can we make sure it is done quietly? We don't disturb the proceedings. But we are just saying we are not putting any pressure for anyone to stay right until the end of the meeting. Thank you very much. Ukuthi-ke kukhona abanye abakuney'ngxaki ezibenza bafuna baphuthume kwezinye indawo noma emakhaya, asizoba kungabe akuzobeka ngathi anisihloniphi uma nishiya umhlangano ninezinye izingxaki, kodwa mekwenzeka lokho kungabi khona umsindo uzoqhubeka kakhulu, kuphume nje kahle abantu ukuthi xwaka.
Baba Dhlomo, yabonga ngixolisa ukukhuluma ngihleli phansi Baba Dhlomo, ukusimo samasikho kahle Baba Dhlomo. Okokuqala Baba Dhlomo ngizocela ukugqizelela kakhulu umayelana nento enithi nayenza namhlanje. Siyabonga kakhulu ukuhlonipha kwenu nize lapha phambi kwethu nizothi ikhalo zethu. Okwesibili Baba Dhlomo, ngempela Baba Dhlomo, abasebenzi beni baka government
Sondeza kuzwakala kushatha kancane.
Ngiyaxolisa nephimbo elincane lokuzalwa vele Baba Dhlomo, ngiyaxolisa ukukhulumela phansi. Ngichaza ukuthi Baba Dhlomo, abasebenzi beni baka government abasenza emakliniki kakhulu ngizogqizelela imfulo ekliniki. Abasebenzi balapha ekliniki ivula ngo-7 kodwa bazoqala ukusebenza ngo-8:30. From 7 till 8:30 abayenzi next baxoxa nje abasebenzi balapha. Amakliniki azosebenza nje, sicela amakliniki avulwe early, abantu bangena bahlala phansi ezitulweni lapha. Lento ukuthi bayatshontsha abantu, kunabantu abatshontsha emakliniki. Abantu bazotshontsha njani ngoba sisingene sisibaningi lapha phakathi. Izinto zitshontsha istaff seni sitshontsha izinto lapha phakathi emakliniki. And second, ngizocela ukugqizelela futhi kakhulu indaba elentweni enikhuluma ngayo enze ngayo lapha phambi kwethu. Cela ukwazi ukuthi nizosebenza njani abantu bangaphandle. Ngoba kahle ngempela amapilisi ne-medication ethu e-South Africa eceda abantu ababuya ngaphandle. Yibo abathatha yonke medication babuya nayo emazweni abo. La e-country abantu basala basokola. Cela nigqizela kakhulu njengoba nizana nomthetho omusha. Labantu bangaphandle sicela bona kakhulu abantu benkosini bavalele ngaphandle. Awuthi asibafundisa abafuna abafundi abathathu basincede isikhathi apartheid. Kodwa manje singaphezulu kwamandla ethu into enezayo. Siyabonga, amen.
Thank you, Dr. Dhlomo. I will sit down because I've got a medical condition. I won't be able to stand. I will speak softly because I'm really short-tempered, so I don't want to raise my voice when I speak. Doctor, the main issue that we wish you to look at is the commitment of staff to their work. Staff in our clinics are not committed to their work. You find them in the morning, 7 o'clock, 8 o'clock in the morning, they are sitting around talking to each other. They don't care about who is in the clinic, nurses in particular. And also on the issue of dispensation, we say we have a problem with dispensation in clinics and hospitals. We don't have a problem. We have staff that is problematic. They are the ones who look into, because they are the ones who finish all the medication in hospitals and clinics. Is the thing that those are the things that we need to look into. We like NHI, but we must sort out the mess in our clinics and hospitals.
Ngizothanda ukunibingelela nonke, igama lami uGcini Muzi, Isibongo Usawuka from TAC branch Mfulo. I'm a community monitor. So what I do is we monitor wonke ama clinics while I Gauteng, not only Gauteng and any other 7 provinces across South Africa. Babu Dhlomo, directly to you, I would like to send an invitation. Take you and hold you by hand so that you can better understand what we are talking about when we are saying let's fix the healthcare broken system. It is within pleasure to actually ask you this question. Have you noticed ukuthi our people are waking up as early as 4 a.m. to start queuing so that they can be admitted? Now the issue is, bavuka ngo 4 ekuseni labantu abadala, ama clinics they are still closed. Some of them are getting raped. Some of them are victim we crime. Baba bambinkunzi, baba tatela ma belongings up. And we believe ukuthi if we need to access wonke ama healthcare services wethu, it's within the issue of safety and security. Secondly, ama clinic wethu avula ngo-7. Ubaba just mentioned something manje ukuthi they are starting working at least around at 8 o'clock. So now the question is, who is paying that hour while they are sitting and doing nothing there? Secondly, sine issue ye medication. There's no medication in Goma clinics. Not long ago, I visited Ijabavu clinic, whereby they've got almost 15 lines ye medication, which is not on shelves. We've got proof of what we are talking about. Now the question is, who is not doing the job? Ubani lo onga odi or ubani lo onga deliver? Thirdly, the consent. The issue yabantu abakhulelwe ema clinic. We've got an issue, Jabulani Hospital. One of the work abantu ekumele ngabe basiza ama patient, they are not doing their job. Mina, I am standing here having a testimonial whereby my girlfriend was pregnant. When she was due to give birth, they have told her, "Ukuthi akunambhede. You should come back on Monday." And she was supposed to give birth on Friday. If I did never fought simply because I'm an activist, meaning I could have lost my daughter. Angakaqedi baba ngiyaxolisa. Because I'm trying to speak on behalf of the other 7 million who are accessing wonke ama clinics wethu baba. We've got an issue of staff attitude. It's cool. We've got an issue of staff attitude. Abonesi bethu, the way they are addressing our patient, and we do understand the reason why, because now they are under pressure. Lastly, baba, ngokukhulu ukuhlonipha. Lastly, engifisa ukuyiveza futhi, the clinics, toilets are dirty, and I believe there are people who've been paid to clean those clinics, and I believe ukuthi there should be ama-tissue ema-toilet, but we don't have all those things. Akunayintsipho. Mabaqeda ukuzisiza abantu abadala, you know what they do? They use into zabo ukuthi bakwazi ukuzivikela. And lastly futhi ngiyaxolisa baba. No, you need to listen to ama consent wethu.
Hamba uye kulela tafula and write them down and leave your name and your number kulela tafula. Whatever esingakubhalanga la kusasele sokuthola etafuleni.
Noted.
Nazo.
My name is Trinumuzi. I'm from TAC. I'm a ward clinic monitor, or I'm a monitor of clinics. Dr. Dhlomo, I want to challenge you by holding you by a hand, and I take you to hospitals so that you can see for yourself. People arrive at clinics as early as 4 a.m. They remain there in the queue. The clinic is still closed. They wait until the clinic is open. They also don't get prompt help from the clinic workers. And another challenge is that the old age people also go to clinics and stay in long queues. And they run a risk. Some of them get raped or abused, sexually abused by other people. And also the issue that the previous speaker spoke about, the issue of clinics being opened at 8 a.m. Yet people have been there as early as 4 a.m. That issue is also a challenge. We also got a challenge with the treatment of pregnant women. Pregnant women face a lot of neglect in our clinics and hospitals. Like my girlfriend went to the clinic. When she got there, she had to deliver. She couldn't be allocated a bed because the nurses said there is no bed. She must go back home. Yet she was supposed to deliver on that particular day. And also the issue of toilet papers in the toilets. Even elders experience a problem of using toilet papers because there are no toilet papers.
So I want to deal directly with chapter 8 in particular, where it talks about the role and the powers of the minister. The minister firstly is overcompensating himself with powers to do another state capture within the health sector. He wants to appoint the CEO, he wants to appoint the board, he wants to appoint all the committees that are there. I'll make a specific example. In chapter 4, number 14, it reads as follows. The minister must appoint a chairperson from amongst the members of the board as contemplated in subsection 13, number 1. That's one example. Also, when we talk of procurement, in chapter 8, paragraph 15 and 40, when we talk about contracting unit for primary health care users when they are buying services from other people, are we not also going to see another issue in Midiosa whereby another Buteles is going to benefit and our people are not benefiting? And also talking to Imidiosa, because even till this day, no action has been taken. It simply shows that when you are corrupt, you will be rewarded with more corruption. Hence now they want to buy services from those corrupt individuals. And again, we're asking ourselves, how are we going to hold these people accountable? Also, the issue NHI dealt with behind closed doors where no community members are supposed to go in, it's also a serious issue because that's where state capture starts. Behind closed doors where no one can see why the minister is doing 1, 2, 3, and 4, 5, 6, and 7. So that's one thing we must deal with. The minister must not overcompensate himself with powers he does not have. And the NHI must not even dare give him that power.
Thank you, colleagues. My name is Mabalane Mfundisi from Sanak Civil Society, but I'm from an organization that forms part of Sanak called Show Me Your Number. So I'm going to read and not paraphrase. Sanak Civil Society Forum, we're made up of 18 sectors, including labor, people living with HIV, and collectively we represent over 15 million people. We have long called for the implementation of universal health coverage care in South Africa. So the NHI is very late. At the apex is that Gauteng is one of the 3 provinces that provide competent services to LGBTI persons, even though not fully at scale. We want to see this happening in all 9 provinces, and this goes with regards to all provision of health services. NHI should result in youth-friendly services, we must emphasize. So all those elected and all those appointed should ensure that the health care system must be fixed. Last year, the president and stakeholders signed the Presidential Health Compact and the HODs here. We shouldn't be engaging members of parliament about work people are paid every day that they are not doing and set up tables there to deal with issues that they must deal with every day. We cannot have that. We are dealing with a policy, not solving issues that people are paid to address. So when the idea of the national health insurance was introduced many years ago, and I must say 25 years ago in the RDP and some of the resolutions that were made, we called for the NHI, and 25 years later we are still here. We don't know, what is the problem, but we will paraphrase it as 2 things, and we are urging you as you are dealing with this bill to move forward. First is that the private sector is hell-bent on maximizing profit by excluding the majority of South Africans, especially the poor, from accessing health services through stealing money meant for public health system to subsidize private health system by sustaining apartheid-era medical aid tax benefits. This has resulted in South Africa currently spending just 8.5% of the GDP, and that 4.4% is spent on providing healthcare service to about 16% of the population. That's 52% of the money in the GDP goes to 16% of the population, whilst 86% of the population have to deal with only 48%, and that is politically incorrect, and it is a travesty to justice. And you are here because we have elected you not to come listen to us, but to change what needs to be done. So, Chairperson, as we fully support the NHI, We want to see it being implemented, and we don't want this process to take longer than it is taking. We don't want you to be in some private rooms behind closed doors trying to address issues of people who are threatening that they are going to leave the country. If they want to leave, they must leave, but they have not left because they are benefiting. Thank you.
Ibambe lapho lama point lawa amanya technical obowaphakamisa mawayilapha ya etafuleni.
My name is Bonile Fandesi. I fully support universal health care. However, this NHI is not what it's promising to be. Let me elaborate as to why I'm saying it is not. NHI in its main is only a funding model to fund the actual cost of providing health care. And in my view, it's going to take the resources from where they are needed. Where are the resources needed? The resources are needed in the hospitals, they are needed in the clinics. You haven't even said as to all of these committees that are going to be appointed by the minister, what is that going to cost? The administration of the actual NHI is going to take the resources that are needed to increase the pay of our nurses and the doctors. So in my view, in as much as we want universal health care, we want universal health care where the resources are actually going to where they are needed. Because if you look at all our hospitals, they do not have adequate resources. And the NHI, it's not like there's another money that is coming somewhere else that is going to supplement what the current budget is. Because we already know the fiscus is stretched to the limit. There is no new money that is coming. Treasury needs to find money, and that money must go directly to the actual health care, creating additional SOEs. You know, now if ESCOM is failed, we don't have electricity. If this NHI fails, there won't be any health care. Thank you very much.
Good morning. My name is Tau Majuja. I'm from Show Me Your Number, but representing the SANAC human rights and legal sector. As a sector, we support the NHI. We are saying that it has been long overdue, Mr. Chairperson, and it's about time. I've been listening to people criticizing, questioning the NHI, but I have not heard a single one of them coming up with a solution as to what is the alternative. Are you saying the current system should continue? That's my question to you, if you say you don't want NHI. But my support obviously has a but. We need to address the issues of powers between the minister and the MECs. Because currently, if you look at the problems that comes up through the health sector, is because of the powers of MECs and the minister, because who accounts to who? MECs account to premiers, and the minister accounts to the president. Now, that's where the problem is. We need to address that issue in the NHI. But in respect of the powers of the minister, I always sometimes look at Google, look at, sometimes when you run something and it's new, you need to close people out so that you can be able to achieve what you want. Otherwise,
Sondeza umbhobho. Come bring it close. Umbhobho wakho must bring it closer to your mouth.
Okay. I guess sometimes, especially administration, do we really need to vote in terms of, putting the policy into implementation? I mean, if you check, even this is an act. You don't even need 2/3 majority to pass it. You need 50% plus 1. That's it. It shows that if there's a problem, we can always go back and amend. Thank you very much.
Sanbonani, igama lami uJabulani Khumalo. Ngingumngoma. Ngiyinyanga. Ngime lapha representing one of the organizations, my traditional leaders. I've got just 3 points. Eyokuqala ukuthi in principle we support the NHI. Secondly, we recommend that the issue of alternative healthcare modalities should be explicitly included in the bill. I'm not sure at the present moment whether that is the case, but we are saying that should be included. Now, just to go back kancane on the background, you know, the universality which is being mentioned here was an idea that was promoted since the 1970s in the United Nations to say all the sectors, the health modalities in a country should work together to provide health care. And you are saying this bill should do that, reflect that principle which has been established since the 1970s. And number two, we would recommend ukuthi, the department should also engage with the alternative healthcare sector. Now the alternative healthcare sector, it includes what we call traditional healers, but it goes beyond that. I think you know that. So we're saying all those sectors should be included, and all those sectors should be, the department should engage those people, you know, because I hear that there is going to be a standard whereby you qualify to be on the NHI. I think we need to have that discussion with the department and all the people in the alternative healthcare sector. For our side, we have already started because we are engaging already in Gauteng department. I think there are some officials from the department who know us. We've been engaging even on this one to say how we can contribute and make this thing successful in a broader sense. So, Nyabo.
Thank you, Chair. My name is Jabulani Khumalo.
He was doing it in English and Zulu.
My name is Jabulani Khumalo. I'm a traditional healer. I have 3 points to raise. In principle, we support NHI. We recommend that with relation to the alternative healthcare services, we should include the traditional healthcare services as well. Because the issue of universal healthcare coverage is an issue that was established as early as 1976 by the UN. So at the moment, we are busy engaging with the provincial.
That was done in English and Zulu.
Good afternoon. Thank you for the opportunity. My name is Mpho Phalatse. I'm a medical doctor by profession, former MMC for Health, and now Shadow MMC for Health in the city of Johannesburg, and I represent the DA caucus in the city of Johannesburg. We agree with the concept of universal health coverage, so equal access to quality health care for all, irrespective of socioeconomic status, and with financial risk protection. We also agree that South Africans, particularly poor South Africans, have been denied the quality health care that they need. However, we do not agree that setting up an NHI fund will magically just translate into quality health care. We believe that what this country needs is good governance. The imposed tax that is suggested to set up this fund is a form of secondary victimization of ordinary, innocent South Africans who are already reeling under an ailing economy. Similar funds have been set up in this country. The Road Accident Fund, the UIF, the Workmen's Compensation Fund, none of them have worked. They've all been open to corruption and maladministration, and this fund will be no different. Longer waiting times for specialist services under the NHI, these will lead to complications and unnecessary deaths of innocent South Africans. South Africa already has a human resources for health crisis. We're seeing a lot of our doctors and our nurses opting to work in countries like Canada and the UK, and this is before the implementation of NHI. Many of the remaining ones have already indicated an interest in moving to other countries.
We are
Iskhat.
okusele koyetafuleni khuluma nje kahle kulandeleke ngoba kulandeleke musushe. If you are too fast, we miss out on what you are saying.
I will start with the human resources for health. South Africa already has a human resources for health crisis. A lot of our nurses and our doctors prefer to work in other countries like Canada and the UK because of better conditions of employment in those countries. And this is before the implementation of NHI. Many of the remaining ones have already indicated that should the NHI bill be implemented, they will also follow suit. Now, the health system is a labor-intensive system. The health system in South Africa cannot survive should healthcare workers migrate to other countries. The NHI will collapse the health system in South Africa. We believe that we can give South Africans universal health coverage without this proposed NHI, and we believe that we should ask the Western Cape how they do it. Thank you.
Good afternoon, everyone. Chair, I need you to clarify. Most of the people have left already. So, ama responses walo mhlangano namhlanje sizothola kanjani njengomphakathi. Igama lami uNonhlanhla Sifumba ngiphuma eWard 37 eOrlando West Extension. Chairperson and all the members of the National Assembly. NHI, I see it as the beginning of the end for healthcare in South Africa. The reasons I'm stating this, Dr. Dhlomo, earlier on you mentioned that NHI will be protecting people's financial health. Then my question would be, how will it improve the people's financial health when the bill does not in any way seek to speak to the entire quality of healthcare for those who will be relying on it? It just simply speaks of lumping funds which flows in the public as well as the private sector together without a strategy and a system overhaul in this national fund will not automatically improve the lives of the people. The second point that I'd like to make is that the establishment of this fund, it says it will be managed like an SOE or a state-owned entity. This is likely going to be open to corruption. We all know what is happening at ESCOM. We all know what is happening at SAA. So how are we going to hold all the public representatives who will be running with this accountable? There are also no proper governance structures to ensure that the board that will be appointed by the minister, who has been given all the powers, will manage the funds independently. The minister is likely to going to appoint those loyal to him, and this fund might be looted like ESCOM, SAA, and the likes. Kulungile baba. Ipoint lokugcina ukuthi iNHI also seeks ukuthi thina njengabantu bala eMzantsi Afrika sihlupheka kangaka ama taxes wethu anyuka. Leyo mali izophuma phi? Ugogo ohola umndende uzoyithatha phi imali enjalo? So ngaloko sithi we adamantly refuse ukuthi abantu base parliament beze la and enforce this without ukwenza ama feasibility studies are right, without checking ukuthi will this NHI fund work in South Africa for the betterment of the people's lives. Thank you.
Thank you, Chair. Thank you for this opportunity. My name is Lebogang Molaisi. I'm from COSATU. I'm the policy coordinator there. I would just like to indicate that we support the implementation of the National Health Insurance. We think that it's actually overdue. We reject the proposal that we should keep on having a two-tier system, one that services the private sector, of whom their patients are white in majority, and one that services the poor, which is a public health sector. Chair, we believe that even after 1994, we made the mistake of continuing to perpetuate an apartheid in the health sector, Chairperson. That is why the unequal distribution of medicines, the unequal distribution of equipment, and the unequal distribution of healthcare facilities. If we do not implement the National Health Insurance, we are saying that we are anti-democracy. In the lead up to democracy in 1994, there were always these notions that people would leave this country if democracy would ever take place. We would like to say, Chairperson, that 26 years after democracy, these people are still in South Africa. I also want to make this inclusion that this fallacy around the leaving of healthcare professionals, they must also understand that the countries that they are going to have national health insurance in their countries. So this policy that they are leaving here, where will they go to? Because those systems are under a national health insurance policy. Chairperson, I want to talk about this last point before I wrap up. The National Health Insurance Bill is going to protect us from the corruption in the private health sector. How is it that a C-section can cost you one thing in public and cost you 5 times in the private health sector? Workers cannot afford this anymore. We want to eliminate this corruption. It was exposed in the Health Market Inquiry report. There is corruption in the private health sector. We welcome the regulation of the private health sector, and we call for the national health insurance. Thank you.
Bahlali, ake simeni kanje, we are doing recordings here, which we will have a space to listen to in Cape Town. But we are also taking our own notes. It becomes a bit of a challenge if you drown the speaker by clapping. Because we can't force you, why don't you clap at the end if you so wish? But if you clap while they're speaking, we lose out. Asikwazi ukubalalela kahle uma niqhwaba kangaka. Siyacela uba ke sizibambe, sidlalele isikhulumi siziqede. Mekunothi unento ke ethi qhwaba, ngcono ungaqhwaba mase beqedile. Kodwa manje siyalahlekelwa ngoba noma zikhona le recordings zama camera, nathi siyasibhalela ngokwethu sibe siluze mase nisivala kanjena nishaya izandla.
Thank you, Chairperson of the Health Portfolio Committee, Dr. Dhlomo Mkhize. My name is Kingsley Tlubatla is my surname. I represent Ward 23, and I represent the Black Pharmaceutical Industry Association as chairperson. For starters, I need to make it very clear we are very supportive of the NHI chairperson. Actually, in 1994, when the African National Congress took over, we were supposed to implement it on the 28th of May and not wait until 25 years to implement the NHI. I need to make it very clear as well, in support of the NHI, that we can learn from countries that have implemented the NHI, like Japan. Japan, after the Second World War, it introduced the NHI to rebuild the economy. With where the economy is in South Africa, we need to do the same as well. We need NHI yesterday, Chairperson. The NHI is very quiet on BE and transformation of the sector that has remained untransformed in the 25 years. We need to transform the registration of medicines, Dr. Mkhize. SAPRA needs to be transformed. SAPRA to this day remains the only institution in our country that does not represent, or that does not recognize, rather, the BEE. SAPRA recognizes, I'll make an example. It prioritizes products. SAPRA is South African Healthcare Products Regulatory Authority. SAPRA is the only institution in this country that does not recognize BEE. Secondly, it does not recognize and prioritize products that will be manufactured locally. To support the NHI, we cannot as a country continue to depend on India for essential drugs like metformin, like paracetamol. It cannot be that 25 years of our democracy, we are depending on imports of simple, essential drugs from India. When in 1970, South Africa had to produce more pharmaceutical products than India. Lastly, one of the speakers here spoke about a resolution that was taken in 2007 in Polokwane to manufacture medicines, especially API, for ARVs. We need that. And lastly, as I close, Chairperson, we need to repeal Section 8.2 of this bill that does not, that actually recognizes medical aids, because it's a contradiction in totality of NHI, because we know Medical Aid Act of 1998 has commodified healthcare system to make sure that white monopoly capital commodifies and make money out of health instead of provide healthcare to the majority of the people of this country.
Okay.
Thank you.
There's a comment that you have made about SAPRA medicines, EDL. Please go and write that point down there on the table. I would like to follow and leave your name and number as to what was the issue on the SAPRA. But they are not here to help us to understand, but it's one of the entities that are reporting to us. Thanks.
Ngiyanibingelela Baba Dhlomo ne committee. Igama lami uSilindile Mpele. I'm from Nehawu in the policy unit. As Nehawu, we fully support the implementation of the NHI for the mere fact that it's here to correct one of many injustices that our people are facing. And again, it is not true that the private sector has no role that it's playing in the failing of our health system. It's playing a huge role in the failing of our health system. And we say it needs to be regulated. The functions and the practices of the private sector is impacting on the public sector. And in that way, it needs to be regulated. For those who say that the NHI will take away the right to choose whether you want to go to private health or to public health, we can't allow that. The right to choose cannot only be limited to the group that only have money. It can't be for those who only have access to money. What about those who don't have money and they want that choice to choose between private health and public health? Are they not supposed to have that right? It cannot be correct. So I stand here and you say, as a country, we need a system that allows for everyone to have access to health care. You said it, Babu Dhlomo. Access to health care is a right that supersedes any other right. That is correct. It supersedes every other right, and everyone has the right to have access to health care. It's not limited only to those who have money. Again, for the NHI to be sustainable, we say, let's build our own infrastructure. Let's build clinics. Babu Dhlomo, Kwanongoma, Dhlomo Dhlomo, in Silowa, there's only one clinic for that village. We need to build our own infrastructure to sustain ourselves. Private sector needs to be regulated. The NHI won't be sustainable if it's still going to be using the same pricing system that the private sector is using. It needs to be regulated. By that, I thank you.
Sanmanan, ngegama nguPhilile wakabongwe and ngiqhamuka ku-Progressive Women's Movement of South Africa. We have a national footprint in 9 provinces and are also represented in district levels in all provinces. As the Progressive Women's Movement of South Africa, we'd like to welcome the NHI bill in that it confirms universal health coverage through a single payer system. And then the other point is that NHI should provide quality health services and capacity at a district level. And then the two last And the two last points is NHI must ensure that the crisis in the health system is addressed. For example, the infrastructure, the gender-based violence that our people face when they go to hospitals, and the issue of demarcation. There was one bekhulumile nge-issue of demarcation, but I'd also like to make an example because it really affects abantu basemakhaya. I'll make an example nabantu abahlala eMatatiyela. Bathenga ukudla or their groceries eKokstad, that's KZN, but Matatiyela falls under Eastern Cape. But when they want to use, have access to health facilities, they need to go to Mthatha for a hospital. So I think we should also look at that. And also NHI, can it move with the fourth industrial revolution? A systematic file. If I am sick, I'm Alexander, so when I'm here at Soweto and I need to have access to health facilities, there must be a systematic file. Gingabuzu address, I'm a South African citizen, and yeah, thanks.
Sanonani Kamangu Buswaga Kumalo from the FBO and Civil Society in Ward 22. We support NHI. My question comes to the doctors that as the people that go to public hospitals, when you need to do an operation or surgery, you sign. They give you a form that you sign. And when anything happens with the patient or whoever has been operated, the doctors are protected from doing a mess with the operation. What about me, the civilian that is there? How am I being protected when the doctor has messed up the operation? Because they tell you that you signed and there's nothing that you can do about it. Because I had an incident where my daughter did not have, her nose was obstructed and the operation was done by the ENT. After that, they told me that because you signed, you cannot charge us. You cannot take responsibility for that operation being gone wrong. So how will the NHI benefit me from coming to hospital and asking for their services while the doctors are being protected while I am not?
Kuphi lapho?
Epara.
Okay. Ngizokufuna ungibhalele leso story siye lapha nami ngisilalele kahle ukuthi ubhale nemininingwane yakho, your name and separa.
Okay.
Ihlekani.
Ela ubhale uyise lapha ndodakazi uphinde ubhale uyise kulela tafula ushiye negama lakho nenamba yakho.
Ihlekani. Nsheweta wakulukumba hinkwavo. Nsheweta bodokotela, nsheweta vele parlamenti. Nsheweta na Dr. wa hina la Gauteng, Dr. Bandile. Mfusheri wa hi Patricia Malebani from Bellavista Clinic, City of Johannesburg, Region F. Mina ni lava ku vulavula ngopfu ku NHI ai amukela. As I speak where I'm standing now, in my clinic we're on a pilot of e-health where we use computers. It's where we congratulate Gauteng so that they have promised us that they are going to implement e-health, and now the e-health is working and it's running. It have made sure that abantu belabela handle abahayibi medication from one clinic to another clinic. So it have assisted us a lot. So we congratulate you, MEC yetu. Nibuya ka makaya disappointment. Our community healthcare workers, MEC, they are crying and they are waking. And in my clinic, in Bellavista Clinic, they made sure that we are nearly there to reach 1990 strategy. So stipend must fall. Stipend must fall. Parliament, it's very painful. The women that are doing these outreach teams, the ward-based outreach team, the CHW, the Warbot, whether it's raining or cold or anything, they are on our doors. They are making sure that they deliver the medication. But at the end of the day, they are being sent back forth. Please, Parliament, can you pay these poor women? They are hungry. Stop giving them stipend, give them permanent, integrate them. Thank you.
Okay, my name is Patricia Malebane. I work for Leicester Clinic. And firstly, I would like to congratulate the MEC of Health in Gauteng, who has made sure that we start implementing e-health as a pilot project in our clinic. So it assists us in a sense that we don't have incidents of people stealing medication from our clinic to other clinics. So we congratulate him in that regard. The only concern that we have is with regards to community-based workers, health workers, who still depend or get stipend as a form of payment. So we would like for them to be employed on a permanent basis.
We have come to the end of our meeting. May I get someone who's going to help to interpret? We have come to the end of the listening program. For those who might have come in late, we started by giving an outline of the bill in a brief way, and therefore said, once I sit down, we start listening. We're listening like we have listened in other provinces, like we have also listened in Soshanguve, and we have listened in Kagiso yesterday. And our listening is to note and write down what we have listened from you, and we are going to put all of that in one pot when we are doing discussions in Cape Town.
Sifike esiphelweni ke sale nkqubo besikuyo niqale ngumamela xa usihlalo becacisa ngalomgaqo-nkqubo okanye ngale bill yaze ke ngoku nayo ikomiti yahlala phansi yamamela emveni koba imamele izawuhamba ibuyele Kapa imamele zonke ke idibanise zonke iingcebiso ezithe zavela apha kunye nezinye ezivela kwamanye amaphondo.
There are certain stakeholders, institutions that have written to us that they would like to come and talk to us about the bill and about other things. And therefore, this was an opportunity again to remind those, if you are a representative of traditional healers, we hope to maybe, if there's a submission there that we are going to meet you, we will do so. If you are an organization of community healthcare workers, we will also be expecting, if there's anything written, we'll meet it there. But the starting point is, it's government engagement with stakeholders. And here we have got government representative. What we then do is to hear programs of government in those things that you are raising, and also be able then to do oversight. Are they doing right, or are they doing wrong, or what can they do to improve? So we would listen and read and get all your submissions if you so wish.
Kuko stakeholders nazo zinazo iziphakamiso kanye isubmission abazibhaleyo abazithumela ukuba ngaba mhlawumbe umuntu lilungu lezo stakeholders makalindele ukuthi usizophinda adibane nekomiti uzawubizelwa mhlawumbe ekhaya kuyoxoxwa khona siya ikomiti iyamamela ize ifunde ezo zibhaliweyo emveni koko kuhlalwe phansi kuboniswane kuba ngaba ke wena ngomnye wabo bantu bebebhalile bafaka iziphakamiso ezibhaliweyo lindele busezophinda ubizelwe eKapa.
Yeah. Lastly, Professor Lukhele, we have listened to a number of issues raised by our people about Protea Glen Clinic, Chawelo Clinic, Moroka Clinic, Jabulani Hospital, Charlotte Maxeke Hospital. We as this committee would want to hear someday progress or issues that have been turned around on these issues. So if we say we need to see you in Cape Town and want to hear what is your report or response on issues that were raised in Dlamini Multipurpose Center on the 23rd of February 2020, you will know what we are talking about. You have a good spot that today you were listening and you still have to go and work your own responses to us. But it should be expected that you need to give us responses on these issues that have been raised here.
Professor Lukhele okhoyo apha umele isebe lesizwe office kamongameli
zikhona izikhalazo ezifakwe ngekliniki eziliqela eProtea Glen Shawelo iMaxeke njalo njalo makalindele ukuthi ethubeni uzawubizwa iParlamente isabele ukuthi kwenzeke ntoni kwenziwe ntoni lisebe ngezi zikhalazo beziphakanyiswe nge-23 kaFebruary apha eDlamini Sports Center.
Ya, siyanibonga ke nonke enithe naphumelela ukuba khona la nahlala impela kwaze kwafinyelela ekugcineni kwalomhlangano. Silalelile ke siqophile nala okuhamba nako siye Cape Town. Siyaqeda ke Gauteng kusasa ngokuba sibe seEkurhuleni, and that will be the last area yokuthi siye emphakathini. Kodwa umama ubethe la kuthathwa izinto zingabuyeli ebantwini, lena izobuyela ebantwini mhlambe hayi ngendlela ukuthi sibuyele la emhlanganweni wenu, kodwa sizobe sinicile sinazisa ukuthi ikuphi le process ekhulunywa ngayo.
We thank you for being patient and patiently waiting with us to attend this program. And this is the last province that we have attended. We've been listening, and your inputs were recorded as well. We will go back to Cape Town and go through all these presentations. Tomorrow, our last stop will be Ekurhuleni. And we heard somebody indicated that we always come back, we always come here and ask people to make inputs, but we don't give feedback. Yes, we will be coming back to give feedback, but it might not be in the same process like today, but you will get a kind of feedback and how far the process is.
Mengase kube khona ngase senzele ufefe sesivala singabulela kakhulu.
Is there anybody to help us with the benediction when we close?
Makasondele embokweni lo ozosikhulekela noma senzele benediction cha. Kahle. Siyakhuleka la sisi.
Dumelang. Ke nna Mavis from Wat 96, Mavis Lepelle. From Wat 96, Ilanzeria. So, renale a big challenge. Ke a kopa, please, it's really late, ke a kopa.
Tata Sokhacha, can you do a benediction for us?
Masimeni kaloku sibambe nufefe.
Can we all
Abantu
rise?
abahamba emaba masiphakameni sonke. May the grace of our Lord Jesus Christ, the love of God, and the fellowship of the Holy Spirit rest and abide with us now and forevermore. Amen.
Mm-hmm.